करेंगे। हाँ, नमस्कार। आप सभी को मेरा नमस्कार। आज के कार्यक्रम के सम्मानित अतिथिगण सभागार में पधार चुके हैं। यह हमारे लिए गर्व और सौभाग्य की बात है कि हम आप सभी का अखिल भारतीय आयुर्विज्ञान संस्थान भोपाल के चतुर्थ अनुसंधान दिवस में आपका हार्दिक स्वागत करते हैं। हम अब हमारे माननीय कार्यकारी निर्देशक एम्स भोपाल प्रोफेसर डॉक्टर माधवानंद कर जी तथा सभी डीन एम्स भोपाल एवं गणमान्य अतिथियों से विनम्र अनुरोध करते हैं कि वे कार्यक्रम के मुख्य अतिथि डॉक्टर राजीव बहल एवं विशिष्ट अतिथि डॉक्टर पीयूष गुप्ता को मंच की ओर लाएं और मंच पर अपना स्थान ग्रहण करने के लिए अनुरोध करें। यह हमारे लिए गौरव की बात है कि अखिल भारतीय आयुर्विज्ञान संस्थान भोपाल के चतुर्थ अनुसंधान दिवस के अवसर पर डॉक्टर राजीव बहल, सचिव स्वास्थ्य अनुसंधान विभाग एवं महानिदेशक भारतीय आयुर्विज्ञान अनुसंधान परिषद (ICMR) हमारे माननीय मुख्य अतिथि के रूप में हमारे बीच उपस्थित हैं। साथ ही डॉक्टर पीयूष गुप्ता, प्रधान संपादक इंडियन जर्नल ऑफ मेडिकल रिसर्च को हम इस अवसर पर हमारे विशिष्ट अतिथि के रूप में स्वागत करते हैं। हम आज सभागार व दर्शक दीर्घा में उपस्थित सभी विशिष्ट अतिथि व अन्य विशिष्ट अतिथियों, विभिन्न संस्थानों एवं विश्वविद्यालयों के डीन एवं निर्देशक, मैनेट, आईसर, BMHRC, इप्को एवं निसाद व खुशीलाल आयुर्वेदिक कॉलेज का स्वागत करते हैं। साथ ही हम उपस्थित कुलपति पीपल्स यूनिवर्सिटी और कुलपति RJPV, महानिर्देशक MPCST तथा मध्य प्रदेश के राष्ट्रीय स्वास्थ्य मिशन के प्रमुख सचिव व निसाद के प्रमुख सचिव की गरिमामयी उपस्थिति के लिए भी हार्दिक आभार व्यक्त करते हैं। कार्यक्रम की श्रृंखला को आगे बढ़ाते हुए हम हमारे माननीय प्रधानमंत्री श्री नरेंद्र मोदी जी के नारे जय विज्ञान जय अनुसंधान के माध्यम से नई ऊर्जा प्रदान करने का संकल्प लेते हैं। एम्स भोपाल का अनुसंधान दिवस इसी श्रृंखला की एक कड़ी है। यह एक वार्षिक आयोजन है जो नए विचारों को पोषित करता है, साक्ष्यों को व्यवहार में रूपांतरित करता है तथा समाज के प्रति हमारी जिम्मेदारी को और अधिक सुदृढ़ बनाता है। यह दिन जिज्ञासा, रचनात्मकता, सहयोग तथा शोध के माध्यम से स्वास्थ्य सेवाओं को आगे बढ़ाने की हमारी प्रतिबद्धता का उत्सव है।
Established in 2012 as a National Institute of Importance by PMSSY, Government of India, AIIMS Bhopal is committed to excellence in medical education, patient care and research, supported by robust state-of-the-art infrastructure. This culture of inquiry and innovation continues to thrive under the dynamic leadership of our Executive Director, Professor Dr. Madhvanand Kar, with a strong emphasis on ethical, translational, and socially impactful research.
अनुसंधान केवल ज्ञान की खोज नहीं है, यह समाधानों की खोज है। यह जन स्वास्थ्य के भविष्य को दिशा देने का माध्यम है और आज का यह मंच उसी संकल्प का उत्सव है। पुष्प सम्मान कृतज्ञता की एक शाश्वत अभिव्यक्ति है। कार्यक्रम को आगे बढ़ाते हुए अब हम हमारे माननीय मंचासीन अतिथियों के पुष्प स्वागत एवं सम्मान की ओर बढ़ते हैं।
We respectfully invite our Honorable Executive Director, Professor Dr. Madhvanand Kar, to kindly extend a floral welcome to our Honorable Chief Guest, Dr. Rajiv Behel. Thank you, sir. May we also request our Honorable Executive Director, Professor Dr. Madhvanand Kar, to graciously offer a floral welcome to our guest of honor, Dr. Piyush Gupta. Thank you, sir. We now request our Dean Research, Professor Dr. Rehan Ulhaq, to kindly welcome our Executive Director, Professor Dr. Madhvanand Kar, by presenting a floral bouquet. We also request Dean Research, Professor Dr. Rehan Ulhaq, to welcome Dean Academics, Professor Dr. Rajneesh Joshi, with a floral bouquet. Thank you, sir. May we request our Associate Dean Research, Professor Dr. Sunita Athavale, to kindly welcome our Dean Examination, Professor Dr. Vaishali Walke, by presenting a floral bouquet. Thank you, ma'am. We now request Professor Dr. Sheetal to welcome our Dean Research, Professor Dr. Rehan Ulhaq, by presenting a floral bouquet. Thank you, ma'am. Proceeding further with the program, we request Professor Dr. Rekha Lalwani to welcome our Associate Dean Research, Professor Dr. Sunita Athavale, by presenting a floral bouquet. Thank you very much, ma'am.
Lighting the lamp signifies the triumph of knowledge over ignorance and illumination of minds through wisdom. We now invite our dignitaries to kindly proceed with the ceremonial lighting of the lamp for the formal inauguration of the event. This auspicious moment will be accompanied by Saraswati Vandana by students of Nursing and Allied Health AIIMS Bhopal, invoking the blessings of Goddess Saraswati.
सरस्वती नमस्तुभ्यं वरदे कामरूपिणी सरस्वती नमस्तुभ्यं वरदे कामरूपिणी विद्यारम्भं करिष्यामि सिद्धिर्भवतु मे सदा विद्यारम्भं करिष्यामि सिद्धिर्भवतु मे सदा सुरासुरै सेविता पादपङ्कजा सुरासुरै सेविता पादपङ्कजा करीशराजितगमनीय पुस्तका करीशराजितगमनीय पुस्तका वाणी मां पाहि कीर्वाणी मां पाहि वाणी मां पाहि कीर्वाणी मां पाहि वाणी मां पाहि वीणा पाणि मां पाहि वीणा पाणि मां पाहि वाणी मां पाहि पन्नगवेणी मां पाहि सरस्वती नमस्तुभ्यं वरदे कामरूपिणी वरदे कामरूपिणी वरदे कामरूपिणी
Thank you all dignitaries for inaugurating today's event. We request you to take your seats on dais. We sincerely acknowledge and appreciate the students of Nursing and Allied Health Sciences of AIIMS Bhopal for this soulful and graceful redemption. We now move to further proceeding. We are deeply grateful to our respected Dean Research, Professor Dr. Rehanul Haq, under whose able guidance research at our institute has evolved from an academic requirement into a culture of innovation, ethics, and impactful scholarship. We now invite Dean Research to apprise us of the research progress, achievements, and milestones of AIIMS Bhopal over the past year and to present the Dean's report. Over to you, sir.
So a very good afternoon to all of you. I think this is a proud moment for AIIMS Bhopal. We have the DG ICMR with us. And as it is my humble duty to present the report, I think I will go, we have heard, sir, and I think we have got very new ideas, and we just have to present what AIIMS Bhopal is doing. So if you look at AIIMS Bhopal, it is an institute of national importance. Can you have the next slide from this thing, please? So it is an institute of national importance, and the most important mandates are teaching, training, and research. And what we have really done is to conduct research that is relevant to the need of the society and to the needs of the country. I think this is not moving from here. So the basic aim of doing research and the research cell is to create an environment where physicians, where scientists, where clinicians and everybody can do research, and that is the job of the research cell. At present, we have the Dean Research. Under the Dean Research, we have the Associate Dean, and I'm very thankful to have a number of faculty members who work as administrative officers in the Dean office, and a number of committees like the Undergraduate Research Forum, the Postgraduate Research Forum, etc., who report directly to the Dean Research. And I think my job is very, very simple. I have to ease the business of doing research at AIIMS Bhopal, and that is the mandate that has been given to me. And I think if there is anything that we can improve, we can always take feedbacks and try to improve those. So there are certain best practices that we have implemented at AIIMS Bhopal to foster an environment of research and innovation. If you look at them, they are human resource development, establishment of research facilities, collaborating with other institutes, funding for research, and last but not the least, streamlining of the institutional processes so that the researchers do their research, and it is the Dean Research Office and the research cell which takes the brunt of all the legwork that goes behind it. I have been talking of the Undergraduate Research Forum because this is a unique concept at AIIMS Bhopal, and this handholds the undergraduate students because we as an institution realize that the most important human resource that we have is a large number of BSc nursing students. And if we can cultivate their minds to do good quality research, these are the people who are going to take this nation forward, and these are the people who will be most productive for us. And I'm very happy that we have an undergraduate forum which is very, very vibrant. They do frequent journal clubs, preclinical quizzes, and research methodology workshops. And I'm very hopeful that this idea would be taken to other institutions. So, sir was talking of how many projects that you have. I think in the year 2024, we had 21 STS projects from ICMR, and I think it is a huge number. Sir said probably it is even AIIMS Delhi. So a big round of applause for my undergraduate students and also for the Undergraduate Research Forum. The other discussion that we have today is about the postgraduate research. So we created a postgraduate research forum so that the postgraduate students understand the importance of research and they don't think of their thesis as something which is a burden. And again, the number of postgraduate ICMR PG thesis grants that we have got has increased exponentially from 3 in 2024 to 2025. And now that we have the DG ICMR with us and the students are motivated, I think this number is going to go up further. PhD research, I think is something which doesn't happen in a medical college, because if you go to most of the government medical colleges, there are very few PhD students. But at AIIMS Bhopal, this has increased. We now have 89 PhD students, and a number of our faculty are doing ICMR projects. Thank you. Talking of faculty development, any institute is only as good as the faculty that you have, and for this we have large number of faculty development workshops going regularly. This is the MedTech Hackathon that we recently talked of, and this is a very new project that we have come up at AIIMS Bhopal. A total of 31 projects were received, 12 were scrutinized, and all have been funded. The ethics committee, I think, is the heart and soul of any institution. It takes the brunt from the faculty कि हमारा paper आ गया है, ethics committee उसको evaluate नहीं कर रहा, right? But that is not true in AIIMS Bhopal. I told sir that we have a very, very robust calendar. It works in sync with the research review board, and it does its jobs very nicely and very quickly. Sir, these are some of the centers that we have. We have the Center for Precision Medicine. We have the Center for Innovation. We have the Regional Virology Lab. We also have the Intent Center. We also have the Diamond Project. So these are already there. Some of the new projects that have come up are the Multidisciplinary Research Unit, the Regional Center for Health Technology Assessment, and the Inter-AIIMS Collaborating Center for Assistive Health Technology. I think we have so many senior people sitting in the front, and we all understand that in 2026, no institute can progress without collaborations. So what we have done is we have collaborated with almost 50 to 60 both state, national, and international organizations. So we have collaborations with ICER, IIT Indore, IIM Indore, and these are some of the very important collaborations we are looking at to grow in the future. There was a discussion about the intramural funds, and I think this is a number that we would want to increase in the future. Extramural funding, I think, is something which we always talk of. So as of today, we have 338 intramural projects, extramural projects that have been awarded to the faculty of AIIMS Bhopal. In this year itself, we got 42 projects, and I think this number is again going to grow. And I request all my faculty members that now with Sir over being here, you have interacted with him, the number of projects should definitely increase. Again, a big round of applause for Dr. Anand Kumar Maurya. I think it is very rare that you have a faculty member who gets not only the intermediate grant, but also the small grant in the same year. And besides that, 6 of our other faculty members have got the small grants of the ICMR this year. The first in the world again was talked today. This is an ICMR initiative where you give an idea which may not sound to be completely off track, but it will be funded by the government. And I think this is a very, very good initiative. And again, a team of researchers led by Dr. Babulal, Dr. Anshul, and Dr. Sakat have won this. It is only 1 out of 38 in the country, so almost 1,700 applications. And AIIMS Bhopal won this thing. I think we should really be proud of it. If you look at the PubMed index publications, we get around 300 to 350 publications every year. And we are only looking at quality. So only PubMed index, if we increase this number to look at other these things like Scopus and all, the numbers would be around 1,000. And Sir was saying, how do you identify the quality of a journal? How do you identify the quality of a paper? How do you identify whether this paper would be cited or not? I think the single important benchmark in the initial time is what is the impact factor of the journal in which it has been published. And I'm very happy that in the last 1 year, we have faculty members who have published their papers in New England Journal of Medicine, in Lancet, and most of the good journals in the world. These are some of just the glimpses of some of the publications that have happened at AIIMS Bhopal. This is the paper I really am very, very fond of. One of our faculty members from the Department of Anatomy, along with other clinical departments, have discovered a gland for the first time in the world. So this is a gland which is in the lungs. There was some idea which people had about it, but it had never been documented. So they did a cadaveric validation of this, and they also found a gland, they also found a duct, and this is something like the first in the world basic research. IPR and patents, I think gradually this culture is coming up. We have 35 patents that have been filed in the last 3 or 4 years. 16 of these patents have actually been published and 7 of them have been granted. We have a journal of our own which is called Future Health. It is in very, very infancy, but I am very, very sure that the team that we have is going to take it to the next level, and we are going to look at years from now, maybe it will be one of the PubMed index journals from our own institution. I think whenever an environment of research is created, it results in awards and accolades. So our faculty and students, when they go to state conferences, national conferences, and international conferences, they have been recognized and they have won number of awards. This is again just a glimpse of some of the awards that were won by our faculty and students. Next. And yes, I think Dr. Joshi was talking of perception. So if you look at NIRF rankings, there are 10 marks for perception, and if you don't perceive how good an institution is, most of the times those marks tend to go down. But it is only by the print media, the general media, and the electronic media that this perception improves, and a number of research that has been done at AIIMS Bhopal is cited in the newspapers, both locally and nationally. And I think, can you just go back to the previous slide? So if you look at the NIRF rankings, every year we have been improving. We were 38 in 2003. It has improved to 31, and now we are at 25. So I think I would request all my faculty members to continue to work on it and take it to the next heights. So what is the future? I think the future, I had made this slide, but I would want to change it based on the discussion that we had today. Sir, I think we need to create an environment of research in the institution, and that environment of research needs to be facilitated, and certain policy changes have to be brought about so that it can be. Next. So I welcome all of you to the third Research Showcase Day. Thank you.
Thank you, sir, for the comprehensive overview of our institute's research journey and achievements. It is our great honor to welcome our Executive Director, Professor Dr. Madhvanand Kar, a distinguished surgical oncologist and an accomplished researcher and medical leader. Under his visionary leadership, AIIMS Bhopal is witnessing remarkable progress in research excellence, cutting-edge innovation, and world-class patient-centric care.
Thank you. Good afternoon, all. Respected DG ICMR, Secretary Health, Government of India, Dr. Rajiv Well. I'm very happy that he accepted our invitation and come to visit Bhopal and inspire our faculty and students. I am personally very grateful to Dr. Bahl, though I know him from my AIIMS days in 2000, but we don't know each other that time. The like AIIMS culture is like that, you have to work, don't know each other. Dr. Piyush Gupta, another my senior, I know him from my residency days, Editor-Chief in Indian Journal of Medical Research. Dr. Joshi, our Dean Academics, Dr. Rehan, the Dean Research, the man of this day today. Then Dr. Basheli, Dr. Sanitha, invited faculties like Dr. Roli Mathur. I know her from my faculty days from AIIMS Bhubaneswar, who is spreading and improving the bioethics or bioethical research in all institutes. She is from Bioethical Research Unit from ICMR. Dr. Kaushik Chatterjee, I was working and I am working with a very close association with him, and biomedical engineering has now the chair and professor biomedical engineering Indian Institute of Science. Dr. Kaji, who has developed this in a private setup, inviting the like ICMR, MRAU, and role model for many. Invited vice chancellors, directors of the reputed institute of the state and around Bhopal and outside, my dear faculties, students, and delegates from institutes and outside. This is a very proud privilege for me to be here. It's the 4th research day. As usually you know that the AIIMS stands for 3 things. This is the research, training, and patient care. But because of the new AIIMS developing with some hope, going to each state by the vision of our Honorable Prime Minister, patient care becoming the topmost priority, where the training comes the second and research becomes the third. But simultaneously, when we are pronouncing this, we are in AIIMS, we have to focus the research. Someone is asking that is the mandate becoming the diluting the research activities, but this is the mandate of AIIMS. Everyone has to take it compulsory that we have to do research whatever way. This is my experience, I'll say, when I am a surgeon. And perception is that surgeons don't do research. This is when I was in All India Institute of Medical Science in Delhi, when I put my project in the Young Scientist Scheme DST, outrightly they rejected how the surgeons will do research. And that was like clinical research. And that's like 25 years back. Dr. Bayal will be agreeing that at that time, the DNA, RNA, something lab, that is the research people are thinking. And public health was not so coming up, but Dr. Reddy and Dr. Bhan from AIIMS, they have taken the research actually to the public, and where we are now. Dr. Bayal is the biggest example in front of you. But finally, they accepted the project about me. I counseled the doctors, surgeons can do research. Then simultaneously, I have done a lot of, then finally I have done my PhD. That's why I am telling these things. Not like I am projecting myself. Everyone can do. If a surgeon can do research, then so basic science, other people, and don't do, those who are not going to OT, they can do research at a higher level. And now our Honorable Prime Minister is giving everyone, like I am very happy that the young generation, they have imbibed that idea that we can do. What we are thinking we cannot do, we have to go USA, we have to go UK, we have to go Japan to do these things, but now we can do it here. And the most important here, why I grateful to Dr. Bell, I am watching him last 3 years when I have taken the director post in AIIMS Darbhanga. I was frequently going to Delhi and my mandate was that I have to visit ICMR. He changed dramatically. Even if you will go to ICMR, you will see that door is transparent. Means that transparency come to ICMR. Eminence-based research project award has come going to the evidence-based. Not like this is only practice what we are telling, experience-based to evidence-based. This is research award also going like that way. And all ICMR staffs, Roli Mathur Madam is here, this must be telling that things is dramatically changed. But any change needs to be your commitment. Take the comments from your colleagues that he has faced also, I have heard also. People will ridicule you first. I always tell that any good things first you go to the people will ridicule, then they will resist, but they will accept, they will follow. Now that ICMR is giving lot of projects, different ideas, and you all now, first up, you can interact it, that things, we will carry this research ecosystem in AIIMS Bhopal. Second point, now medical, for the students, this is MBBS medical career, not like, this is now medtech. Not like this, you go to only see the patient, do the like examination, got the PG and pass out and do the practice, or someone is in the medical science. Not like that. This is a med tech. This is not like a simple medical school. This is med tech school. Means you have to associate your innovative ideas with the engineering or biomedical engineering, anywhere. That your ideas should come in a bigger way for the use for the patients or patient care. And you are the change for this nation. Third thing, we have to see how we can imbibe with these new ideas. We have to liberate ourselves, invite youngsters, share your experience with their enthusiasm to develop the ecosystem, research ecosystem. That is the idea why I called Dr. Bell, and he agreed. And he is a man who, you must be realizing how he is so passionate to interact with people, forgetting the time. Dr. Kar will take time, but we will interact fast. This means he wants you people to come up and meet the vision of our Honorable Prime Minister that India can do everything. We will not follow like this is the. And second point, why Dr. Piyush Gupta is here, he is leading and changed the Indian Journal of Medical Research dramatically. And see, maybe at next year, this will become the index. And all I request, enrich your own journal. Enrich your own journal, that will give a platform your next generation. If you will neglect now, we cannot give the platform to our next generation. Always we will follow like AIIMS, Lancet, all these things. This the standard is okay. But we have to develop our own standards. We have to contribute to our ideas to our own journals, which will create the platform for our next generation. This is the idea. And always the research day celebration has been importance. You have to inspire and you have to celebrate those who have done the best, institutes have done the best. You have to do the endeavors, and you will inspire to imbibe with new ideas, new advancement in medical science. And this system will enrich the research ecosystem in the institute, which will create a legacy. And you people, because you are first generation faculties, thus you have to create the legacy for the next. Thank you so much. Wish all the best. And I congratulate you all the winners, and few things we will change in coming days, that how we can enrich our own research ecosystem in AIIMS Bhopal. Most of the time, AIIMS Bhopal, like Rehan was asking, why we are not getting the funds, why not doing things, why not going up in the ranks. You will go. What you are doing, you have to encourage. You have to tell people. Otherwise, I'm from Odisha. One thing is Bonara Malli, Bonare Jhadi Jaye. Means the flowers in the forest will go down unless otherwise someone will discover it. Whatever you are having, you have to project. We are doing the thing what you are projecting. That's what our faculties and students doing. We have to tell these things. Now, Dr. Bell has been amazed that Bhopal is doing so much good work and research. Thank you so much.
सर, आपके प्रेरणादायक और ज्ञानवर्धन भाषण के लिए धन्यवाद। अब हम छात्र पुरस्कारों की ओर बढ़ते हैं। आज चतुर्थ अनुसंधान दिवस की शुरुआत एक जीवंत वैज्ञानिक कार्यक्रम के साथ हुई, जिसमें शोध, नैतिकता और नवाचार पर विशेषज्ञ अतिथि व्याख्यान और संकाय सदस्य के साथ संवाद शामिल थे। आज हम उत्कृष्ट शोध योगदान करने वाले छात्रों का सम्मान करते हैं, जिन्हें उनके वैज्ञानिक योग्यता और अनुवादीय संभावनाओं के आधार पर एक कठोर ज्यूरी प्रक्रिया के माध्यम से चुना गया है। साथ ही हम सभी प्रतिभागी छात्रों की भी हृदय से सराहना करते हैं। छात्र अनुसंधान पुरस्कारों की घोषणा के लिए मैं डॉक्टर श्रवणा मुखोपाध्याय, अतिरिक्त प्रोफेसर पैथोलॉजी विभाग से अनुरोध करता हूं कि वह मंच पर आएं और छात्र पुरस्कारों की घोषणा करें।
Thank you, Dr. Jay. Good afternoon to all the dignitaries here and all the audience. So we come to a very coveted part of this event. The continued success of AIIMS Bhopal stems from its unwavering commitment of its faculty and students toward health care research. These research awards were instituted to acknowledge the outstanding contributions by our undergraduate students, postgraduate students, postdoctoral fellows, even project research staff, and faculty in healthcare research. And more than winning, the true value of this initiative lies in active participation, which reflects a shared commitment to advancing the healthcare research. So it gives me an immense pleasure to announce the awardees and prize winners of the 4th Research Day of the AIIMS Bhopal. For that, I request all the dignitaries to please come forward onto the dais to felicitate the awardees. And as I announce the names of the awardees, I request them to also come forward to the stage to receive your awards. So, in the award category, the first category of awards that we will start with is the ICMR Short-Term Studentship Projects granted for the year 2024. All awardees will receive a medal along with a certificate and a cash prize. So I call for that Mr. Ansh Agrawal to come up to the stage and collect his medal, certificate, and cash prize. Next, I call on Mr. Anshul Kenwat to come onto the stage to collect his award. Please give big rounds of applause because they are our undergraduate students who have really made our institution proud. Calling upon Mr. Anurag Singh Tomar to come onto the stage to collect his medal, certificate, and cash prize. Next, we have Mr. Ayush Garg to come onto the stage. Next, I call upon Ms. Bubbala Sathwika. I request Mr. Devprasit Karmakar to come onto the stage to collect his medal, certificate, and cash prize. Mr. Devprasit Karmakar. So this time our institute was awarded 21 ICMR STS projects. I next call upon to the stage Ms. Diptanshu Ganesh to come on to the stage to take her medal, certificate, and cash prize. Mr. Gore Pruthu Swapnil, please come on to the stage next to collect your medal, cash prize, and certificate. Please keep on applauding these students. They are children and they have done us really proud. Next, requesting Mr. Harsh Pratap Singh to come up onto the dais to collect his award. Ms. Ishita Jain will follow next to collect her award. I call upon Mr. Jain Rushabh Shailendra to come onto the stage to collect his award. Loud rounds of applause, please. That's nice. So next I call Mr. Jinjala Darshit Samad Bhai to come up onto the dais to collect his award. So it really feels nice to announce so many names. It shows how many of our students are really doing good. Next, Mr. Lakhani Shril Jitendra Bhai to come up onto the stage to collect his award. I now call upon Ms. Palukkodeti Shrikari to come onto the stage to collect her award. Huge rounds of applause, please. It should keep on going, coming. Okay. So next is Ms. Sara Abhay Jadhav to collect her award. We now call upon Mr. Swastik to come to the dais and collect his medal, certificate, and cash prize. Ms. Tithi Viresh Shah, please come on to the dais to collect your award. We now call upon Mr. Vedant Sanjeev Yelgi to collect his award on the stage. And last but not the least, Mr. Vinit Lokare to collect his award. So now there should be a deafening applause to congratulate all the young researchers on securing this prestigious national grant, bringing great pride to our institution. Thank you so much. So for the next award category, the award is for the best paper by an undergraduate student, be it from MBBS or nursing. And for that, I'm really proud to call on the name of Ms. Shrutangi Vaidya of MBBS Batch 2020 to come onto the stage and collect her award. Shrutangi is just back from Harvard Medical School after doing 3 months of clinical internship, after gaining the prestigious Khurana Scholarship. So these are the bright students, the beacon of academic excellence from our institute, AIIMS Bhopal. Big round of applause. Okay. So for the next award category, another proud moment for us as we recognize the recipients of the ICMR postgraduate thesis grants, which was secured in the years 2024 and 2025. So for that, I first call Dr. Abarna Shri SB from the Department of Forensic Medicine and Toxicology to come onto the dais, and yes, she's been awarded. I now call upon Dr. Arjun B. from the Department of Community and Family Medicine to come and collect his award. Next, Dr. Athira P. from Department of Pediatrics, recipient of the prestigious ICMR postgraduate thesis grant. I now call upon Dr. Badal Beda from Department of General Surgery to come up onto the stage to collect his award. So this list is also quite long, so we have to keep on clapping. We next have Dr. Bhavya Sharda from Department of Microbiology coming up on the stage for her award. I call upon Dr. Divyanshu Adarsh Mund from Department of Microbiology to collect his award. Next is Dr. Fatima Hassan from the Department of Community and Family Medicine. Please come up on the stage to collect your award. So we have another recipient from Department of Forensic Medicine and Toxicology, Dr. Pushpanjali T. I call her upon the stage to collect her award. Next is Dr. Rishika A. from Department of Pharmacology. Big round of applause, please. The next recipient of this award is Dr. Siddharth Jain from Department of Orthopedics. From the Department of Community and Family Medicine, once again, another candidate, Dr. Syed Ashish E.A. please come up onto the stage to collect your award. And once again, last but not the least, Dr. Vaishnavi Gawande, again from Department of Community and Family Medicine, to collect her award. Hearty congratulations to all the postgraduate scholars for this significant academic achievement. So for the next award category, we now move on to the recognition of outstanding postgraduate research work. And in this one, we have three categories. The first one is the category of MD-MS, the best thesis work in MD-MS. And for that, I call Dr. Sabhavat Arun from the Department of Pediatrics for securing the Best Thesis Award. Big round of applause for him. In the next category, which is from the DM and MCH candidates, Dr. Ekta Gupta from the Department of Anesthesiology is called upon to the stage for collecting her award. From MSc Nursing, Ms. Pavleen Kaur has been granted the award, but on her behalf, her guide and mentor, Mr. Vel Murugan, will be coming up on the stage to collect the award. So congratulations to all of them. Now we move on to the award category for the best published paper for students who are of the MD, MS, DM or MCH or academic and non-academic SRs and JRs, including MSc nursing students. So from there we have a student from the Department of Anesthesiology, Dr. Prathamesh G. Kumbhar. A big round of applause to him. So in the final round of awards in this category for students and postdoctoral research fellows, we now call upon for the Best Paper Award for PhD student, Mr. Santena Chanchula. He had a brilliant presentation this morning amongst very esteemed jury and won the first position. A big round of applause to him. So these awards are just not for our students, but also to promote and motivate. We have an award, which is next going to Ms. Jaya Tilakan, Research Project Staff from Department of Biochemistry. A big round of applause for her, please. So that brings to the end of the session 1 of awards. And on behalf of the organizing committee, I congratulate all the awardees and contributors. Your achievements continue to strengthen the research ecosystem of AIIMS Bhopal. Thank you, and I now request Dr. Gunjan to please carry forward the program.
Thank you very much, Dr. Shramna. We now have our keynote by Dr. Piyush Gupta. It is our pride privilege to welcome Dr. Piyush Gupta, Editor-in-Chief, Indian Journal of Medical Research. As an Editor-in-Chief of IJMR, Dr. Gupta has been instrumental in promoting ethical research practices, rigorous peer reviews, and dissemination of impactful scientific evidence. We welcome you, sir.
Very good afternoon, all my dear friends, respected Director General, ICMR, Director, AIIMS Bhopal, distinguished guest, faculty, and my dear students. Thank you, sir, for giving me the honor of presenting this keynote address. आपने कहा रिसर्च पर बोलो तो मुझे समझ नहीं आया क्या बोलें. फिर आपने कहा कि अंडर ग्रेजुएट स्टूडेंट्स होंगे बहुत सारे
और तो आई थॉट कि आई विल मोटिवेट देम, बट अब मुझे अवार्ड प्रेजेंटेशन के बाद लग रहा है कि उनको मोटिवेशन की ज़रूरत ही नहीं है. दे ऑलरेडी आर मोटिवेटेड लॉट. सो hats off, congratulations. But फिर भी for those who are not motivated, because I want कि 21 आपने STS अवार्ड ICMR से लिए हैं, तो ज़रूरी नहीं है कि आप STS का वेट करें. आपके जिन्होंने अवार्ड नहीं भी मिले हैं, they can also pursue their research. उसके लिए कोई अवार्ड की ज़रूरत नहीं है. एंड अल्टीमेटली कई बार ऐसा हुआ, हमने देखा है कि अवार्ड जिनको नहीं मिला, they have performed better and published papers even if they haven't got the award. तो कुछ सवाल हैं रिसर्च में. आई जस्ट बिकॉज आई मेनली फोकस्ड ऑन अंडर ग्रेजुएट स्टूडेंट्स प्राइमरीली. क्यों करना है ना, यही सवाल आते हैं. रिसर्च क्यों करना है, कहाँ कर सकते हैं, कब करें. इतना तो भरा पूरा करिकुलम है, टाइम कहाँ है किसके पास, और कैसे करें, क्या रिसर्च करें. देयर आर सो मेनी क्वेश्चन दैट अराइज. आई लाइक टू आंसर अ फ्यू ऑफ देम वन बाय वन. व्हाई डू रिसर्च? द परसेप्शंस चेंज. एक पोस्ट ग्रेजुएट को रिसर्च क्यों करना है? क्योंकि उसको तो मैंडेटरी है, करना ही पड़ेगा. उसको थीसिस जमा करनी है तो उसको सीखना है. बट एट अंडर ग्रेजुएट लेवल इनिशियल परसेप्शन है, हाँ थोड़ा एकेडमिक क्यूरियोसिटी है किसी के अंदर. कुछ लोगों के अंदर यूजी लेवल में होता है, हाँ मुझे बाहर जाना है, यूएस जाना है, तो वहाँ अगर रिसर्च होगी तो मुझे थोड़ा सा बेनिफिट मिलेगा, वो इसलिए रिसर्च करते हैं. फिर इसलिए अर्ली फेज में इसलिए रिसर्च करते हैं कि 2 पेपर चाहिए वो प्रमोशन के लिए, असिस्टेंट से एसोसिएट से, तो थोड़ा उसके लिए रिसर्च किया जाता है. धीरे धीरे थोड़ा ये होता है कि हाँ बॉस खुश हो जाएंगे. अब हमने 2 पेपर छापे, कार सर ने देखा है कि हाँ ये 2 पेपर इसने 3-4 करता है, ये अच्छा लड़का है, ज़्यादा अच्छा काम करता है. सो दीज परसेप्शंस चेंज ग्रेजुअली. देन अल्टीमेटली यू थिंक इन द मिडल ग्रुप कि हाँ थोड़ा साइंस को कॉन्ट्रीब्यूट करना है. And then at the last level, at this level, at let's say the level of Dr. Rajiv Bahel or that senior professor level, हम रिसर्च क्यों करते हैं? एक तो रिसर्च की आदत पड़ जाती है, दैट इज इम्पॉर्टेंट. वो एक एडिक्शन है जिसके बिना फिर जिंदा नहीं रहा जाता, कि हाँ ये तो करना ही पड़ेगा. वो एक जैसे कहते हैं ना, एक चुल आ जाती है. सो दैट चुल इज देयर. द सेकेंड इज दैट यू कैन कॉन्ट्रीब्यूट टू चेंज इन द प्रैक्टिस एंड पॉलिसी. वो लगता है कि आपने देश की जनता के लिए कुछ किया, अगर वो उसकी प्रैक्टिस पॉलिसी में परिवर्तन ला रहा है. तो ये एसटीएस प्रोजेक्ट लेना, ये अवार्ड लेना यहाँ एंड नहीं है. सर ने सुबह भी एक वो उसमें इनोवेशंस में देख रहे थे, पेटेंट बना देना, पेटेंट अवार्ड ले लेना, दैट इज नॉट द एंड. अल्टीमेटली एंड इज द एप्लीकेशन ऑफ दैट नॉलेज. शुरू में हो सकता है आपको पता ना हो कि इसका क्या होगा, बट एज ही ऑल्सो सेड, थिंक ऑफ द एंड फर्स्ट and then start take it back from there, कि अंतिम उसका उद्देश्य क्या है, और उसके हिसाब से आपका इनिशियल रिसर्च क्वेश्चन शुरू होगा. Who can do research? डायरेक्टर सर ने कहा कि जब मैं कर सकता हूं, मतलब जब सर्जन कर सकता है तो कोई भी कर सकता है. तो मैं तो उससे और आगे जाता हूं. मैं कहता हूं कि एनीवन हु इज क्लेवर इनफ टू गेट थ्रू द मेडिकल स्कूल, आप नीट सब क्लियर करके आए हो, जब आप यहाँ तक पहुँच गए तो आप रिसर्च कर सकते हो. आपको और कुछ नहीं चाहिए, थोड़ी बहुत ट्रेनिंग की आवश्यकता है, अदरवाइज एवरीबडी. और आजकल तो हर आदमी रिसर्चर है, सबके पास स्मार्टफोन्स हैं, गूगल में देख के रिसर्च करते हैं. पहले रिसर्च करते भी थे, अब एआई आने के बाद वो रिसर्च की भी ज़रूरत खत्म हो गई. तो लेट नॉट एआई ओवर पावर योर रिसर्च कैपेबिलिटीज. वो रिसर्च करते रहिए कि कहाँ कैसे करना है. Research can be learned, just there are 2 things which you need to learn about a little bit, that is the study design and statistical method. इसके लिए आपको कोई statistician के पास जाने की ज़रूरत नहीं है, आपको कोई कोर्स करने की ज़रूरत नहीं है, but you can learn this on the job. Ask your teachers, ask your seniors. Dividend of UG research. I am just giving some real examples. 25 years back, I think 28 years back, I was in Nepal. As an associate professor, Government of India had established a medical college there in BP Koirala Institute of Health Sciences, and there was a student, undergraduate ही थे तब, और एक बैच में सिर्फ 30 स्टूडेंट्स होते थे. One of the undergraduate student came to me, I was associate professor, he said, sir कुछ रिसर्च करना है. And मैं उसको टालता रहा, क्या रिसर्च करेगा. फिर लेकिन उसने पीछा छोड़ा नहीं. He came on again, I said, okay, let's do something in the community. This concept had come at that time. ये रैट्स में स्टडी थी. रैट्स में स्टडी थी कि अगर हम डेली आयरन की जगह, डेली आयरन देते हैं ना ट्रीटमेंट के लिए या प्रिवेंशन के लिए, तो रिसेप्टर सैचुरेट हो जाते हैं, फिर इट मे नॉट हैव द डिजायर्ड इफेक्ट और साइड इफेक्ट बढ़ने लगते हैं. सो देयर वाज अ स्टडी इन द रैट्स कि अगर हम वीकली आयरन दें, दैट इज एज गुड एज द डेली आयरन थेरेपी. सो वी स्टडीड in that area of Nepal where majority of the population was non-vegetarian, yet the prevalence of anemia in adolescent girls were almost to the tune of 60 to 70%. So we selected some schools in Dharan municipality, that is in Nepal, and we conducted this randomized control trial through that student only. And in that randomized control trial, we established, that was ultimately published in JAMA Pediatrics, it is known now, that supervised iron and folic acid therapy once a week is an effective alternative to daily administration. That was the first paper. We didn't realize कि इसका impact क्या होने वाला है. And now we realized, after 20 years later, when it was incorporated into the practice and policy in the Poshan Abhiyan, Anemia Mukt Bharat, this is the power of undergraduate research. वो वहाँ से शुरू हुआ और उसके बाद उसके ऊपर वो कैस्केडिंग इफेक्ट बनता गया, रिसर्च पर रिसर्च हुई, एंड फाइनली इट इज नाउ पार्ट ऑफ द नेशनल प्रोग्राम. दैट्स व्हाई आई सेड रिसर्च इज टू इंपॉर्टेंट टू बी लेफ्ट एंटायरली टू द रिसर्चर्स. आपको ये नहीं सोचना ICMR है, इंडियन काउंसिल ऑफ मेडिकल रिसर्च है, इतना बड़ा इंस्टीट्यूट है, ये रिसर्च करेंगे. इसके 30 रिसर्च इंस्टीट्यूट हैं, इसके अंदर 800,000 साइंटिस्ट हैं, ये रिसर्च करेंगे. नो, why should they be only doing research? Everyone is born with the quality required of a researcher. That is the curiosity to explore the world and ask questions. Another undergraduate student, he came to me, third year का student था, उसको STS project उसने कहा नहीं मिला. He said, sir, मुझे फिर भी कुछ करना है. तो I just asked him, भाई तुम क्या करते हो, तुम्हारी हॉबी क्या है? कह रहा मैं टीवी देखता हूँ सर, मैं बहुत टीवी देख सकता हूँ और मैं करीब 7-8 घंटे देखता हूँ. ही वॉज अ डे स्कॉलर, तो घर चला जाता था, हॉस्टल में नहीं था, टीवी देखता था. आई सेड ओके. सो आई थॉट फॉर सम टाइम, आई टोल्ड हिम 1 महीने टीवी देखना है तुझे, 4 चैनल पकड़ो, एक वो बच्चों वाले आते हैं ना, कार्टून नेटवर्क, पोगो, डिज्नी, सच लाइक 4 चैनल्स पकड़ के हर चैनल 1-1 हफ्ता 4-4 घंटे रोज 1 महीने तक देखना है. एंड यू जस्ट नोट डाउन how many advertisement of food-based advertisements are coming on those channels, and how many are for healthy foods, how many are for unhealthy foods. 1 महीना उसने देखा, 1 महीने बाद पाया कि healthy तो था ही नहीं, सारा unhealthy था. And that's how we formulated a policy based on his research. This was ultimately published. This boy is now a leading endocrinologist in one of the medical institutes in Delhi. Another boy who again came to me, he said, I was a topper of my school, मैं अपने स्कूल में कुछ रिसर्च कर सकता हूँ. By that time we didn't know about how much caffeine our children are taking. आज भी मैं आपसे पूछूंगा तो बहुत कम लोगों को पता होगा कि मैक्सिमम कैफीन कंजम्पशन की लिमिट क्या है और एडोलेसेंट कितनी कैफीन लेते हैं. This is a very unresearched subject. So we conducted this study in a school, उसने किया, and we found that Indian children are consuming much more caffeine in as compared to their Western or US counterpart. And further, this led to our policy by the Indian Academy of Pediatrics on junk foods. So that policy was with several such papers. It was not only 1 or 2 papers on junk food, on food. I just given some examples where the research was done by the undergraduate students. कहाँ करना है? ये सवाल आता है ना अभी, तो कहीं भी करो, आपको कमी है, utilize every opportunity. You are in the outpatient, ये फैकल्टी के लिए भी है. आप आउटपेशेंट में मरीज देखते हो, एक वहाँ रिसर्च आपकी चलती रहनी चाहिए. एक इनपेशेंट में है, वहाँ कर रहे हैं. लेबोरेटरी में है, वहाँ कर रहे हैं. डेस्क पर है, डेस्क पर आप एक सिस्टमैटिक रिव्यू कर रहे हो. आप एडमिनिस्ट्रेशन में हो, कॉस्ट इफेक्टिवनेस की स्टडी वहाँ भी हो सकती है. आई वॉज इन इंडियन पीडियाट्रिक्स फॉर 6 years, एडिटर इन चीफ. वी पब्लिश 10 papers on how we handle manuscripts, how the Indian researchers or how the Indian publication end up with manuscript. You are in medical education, you can do research. So utilize every opportunity to deliver research. Involve people around you, have a mentor, and finally provide opportunities, be a mentor. जो आपने सीखा था वो सिस्टम को देने का वक्त वापस आता है, वो सिस्टम को वापस आपको देना पड़ेगा. This is just an example. I was the president of Indian Academy of Pediatrics in 2021. We conducted a nationwide program training 10,000 pediatricians on early development nurturing care. वो training एक अलग part था. But out of this, we also utilize this opportunity to publish this research, to conduct this research. ये जिनको हम train कर रहे हैं, इनकी practices हैं क्या? और ultimately फिर हमें ये पता लगा कि इसमें से hardly they were only less than 5% who were not practicing. मतलब pediatricians बच्चों को जब पढ़ाते, parents को जब counsel करते हैं, they don't tell them about क्या learning opportunities हैं, क्या safety security हैं और क्या responsive parenting hai. So that was an eye-opener at that time, and that paved way for our national, again, programs in the nurturing care and child health. I was into medical education. जब मैं धरान गया, मैं अभी आपको बता रहा था, तो वहाँ I was introduced to this OSCE, Objective Structured Clinical Examination. It was a new thing. 30 साल पहले हमारे लिए नहीं थी, हालांकि हार्डन discovered this and renamed this in 1976. And when I came back, we conducted this exercise in our institution, and subsequently, based on these experiences, this was incorporated in the National Board of Examination as a standard method of assessment tool for the DNB exam. So you start off with the one thing, इसीलिए कोई भी opportunity को अधूरा नहीं छोड़ना है. क्या करना है? कहीं भी problem, common problem, day-to-day problem. Another example, intern came to me, sir, वो पोस्टेड था पीडियाट्रिक्स में, सर रिसर्च करना है, अलग से टाइम नहीं है. इंटर्न के पास कहाँ टाइम होता है? या तो वो आता ही नहीं है, तो फिर तो उसके पास पूरा टाइम है, लेकिन जो आता है वो काम करता है. तो आई सेड ओके, इट डजंट मैटर, यू जस्ट स्टैंड आउटसाइड द ओपीडी. हमारी 300-350 की ओपीडी है. आप ओपीडी के बाहर बैठो, एक फोटोकॉपिंग मशीन वहाँ रख दी, जितने प्रिस्क्रिप्शन बाहर जा रहे हैं, यू जस्ट टेक द प्रिस्क्रिप्शन, फोटोकॉपी ऑफ ईच, एंड एट द एंड यू एनालाइज हाउ मेनी आर हैविंग प्रिस्क्रिप्शन ऑफ एन एंटीबायोटिक. And it was surprising. We found that almost 65% prescription were having a prescription of antibiotics. That was shocking. And after that, we asked him to conduct a training sessions. We asked him to conduct various faculty and train exercises. And after 6 months, we repeated that exercise again. The antibiotic prescription dropped down from 65% to 27%. So that was miraculous. वो उसको कहीं जाने की जरूरत नहीं थी. You just have to think. So the most important thing is in research is identify a good research question. This is a postgraduate research. Now coming to the postgraduate thesis, I'm happy that so many students have won an ICMR award for the thesis. आप postgraduate thesis ऐसी चीज है जहां आप 1.5 साल 2 साल इन्वेस्ट करते हो. तो अगर आप 2 साल इन्वेस्ट करते हो तो अच्छे से करो. उसको सिर्फ घास काटने जैसे नहीं करना कि हाँ खत्म करनी है. और उसके लिए सबसे इंपॉर्टेंट चीज है एक अच्छा रिसर्च क्वेश्चन चुनना चाहिए. I'll give you at UCMS in our Department of Pediatrics, we have a national awards in Indian Academy of Pediatrics. For last 20 years, we have been winning almost 60 to 70% of awards at every national conference. The reason why? Because we select the research question. We take almost 1 year to formulate our research question. जब पीजी स्टूडेंट्स आता है, आप उसको कहते हो प्रोटोकॉल जमा करके वो 2 महीने में उसको दिखाना होता है रिसर्च कमेटी के सामने. So it takes only 2 months. 2 महीने उसको मिलते हैं प्रोटोकॉल बनाने के लिए और 2 साल मिलते हैं डेटा इकट्ठा करने के लिए, which is totally wrong. Because it is the initial planning which has to be given maximum time. Data collection तो हो जाएगा अगर आपका planning अगर अच्छा है तो. So this study we did, and this was later on incorporated in the American Academy of Pediatrics policy. आज भी हम लंबर पंक्चर करते हैं न्यूबॉर्न में, लोकल एनेस्थीसिया नहीं लगाते, एक सुई तो लगनी है, दर्द होगा इससे क्या, और न्यूबॉर्न को थोड़ा रोएगा, क्या फर्क पड़ता है. But it is now a norm in US to apply this eutectic mixture, and this is in their standard policy guideline. Similarly, we had an episode of cholera adjacent to our college, which is nearby a slum area, and we utilized this opportunity to try a new drug at that time, that is azithromycin against the treatment of cholera. And this is now incorporated as a policy in the WHO document, azithromycin as a standard single-dose treatment for cholera, as well as in the CDC document. फिर वही सवाल आता है, टाइम कहाँ है? टाइम तो बहुत है. मैं हर बार सोचता हूँ कि अब वज़न बढ़ता जा रहा है, एक्सरसाइज में कर नहीं पाता. तो मैं क्यों नहीं कर पाता? अरे यार मेरे पास टाइम कहाँ है, मुझे पेपर लिखने होते हैं, मुझे एडिटर करना होता है, मुझे रिसर्च कमेटी की मीटिंग चेयर करनी होती हैं, मुझे घर का भी काम करना है, सब्जी भी लानी है, खाना बनाने का शौक है तो वो भी करना है, वो सब मैं कर लेता हूँ, दौड़ता नहीं हूँ, क्योंकि मुझे पता है, तो मुझे लेकिन ये भी पता है अंदर से कि ये सब बहाने हैं, मैं नहीं कर रहा, मैं नहीं दौड़ रहा बिकॉज आई एम लेजी. सो इट इज द एटीट्यूड, इट इज जस्ट अ चेंज ऑफ एटीट्यूड. आपको जो काम करना है आप उसके लिए समय जरूर ढूंढ लेते हो. आज की तारीख में हर स्टूडेंट, हर फैकल्टी, हर नहीं मतलब ठीक है 99% बैठ के 2 घंटे रील देखते हैं. So you can easily utilize that time. That is a new distraction which people can really overcome. कब करना है वही वाली बात है कि अच्छा 1 तारीख से न्यू ईयर रिजोल्यूशन होता है, 1 तारीख से करना शुरू करेंगे, 1 तारीख कभी नहीं आती. करना है तो अभी करना है और अभी नहीं, अभी आज करना है और आज अभी करना है. Barriers, there are so many barriers. I am not going to discuss each one of them, but again, it's an attitude to research which can overcome all such barriers. Solution है manage your time well. Most important is manage your time. कहाँ compartmentalize करना है, कहाँ ज़्यादा देना है, ये आपको पता होना चाहिए. Collaboration, I think sir has already discussed the importance. Collaboration between yourself. Institute has a major responsibility also for giving avenues for collaboration. I am happy you have so many areas of collaboration. हमने अपनी जगह एक एरिया बनाया कोलैबोरेशन का, वो था एक कैफ़े बना दिया. एक कैफ़े बनाया जहाँ 2 घंटे फैकल्टी को चाय कॉफ़ी और स्नैक्स मिलेंगे और एक टेबल टेनिस की टेबल रख दी. तो सारे लोग आते थे प्री क्लिनिकल से और क्लिनिकल वाले आपस में जिसको जानते भी नहीं थे कम से कम चाय पीने के बहाने वहाँ मिलने लगे. एंड दैट पेव द वे फॉर द कोलैबोरेटिव रिसर्च. सो दीज आर छोटी छोटी चीज़ें हैं जो रिसर्च इकोसिस्टम को इफेक्ट करती हैं. सब लोग अंबानी जी जैसे नहीं होते जो भगवान से कहते हैं कि भगवान कुछ चाहिए तो बता देना. हमें तो मांगना पड़ता है, तो मांगने में कोई हर्ज नहीं है और इनके पास बहुत है, कोई कमी नहीं है, कहीं भी फंडिंग की बिल्कुल कमी नहीं है. द ओनली थिंग इज वही जो सर ने कहा सुबह, जैसे किसी एक फैकल्टी मेंबर ने कहा सर हमने 5 लिखे 10 लिखे, नहीं हुआ तो होगा, कुछ प्रॉब्लम होगी. इसलिए आप देखो क्योंकि नए रिसर्चर्स भी एज वी सॉ 20 न्यू फैकल्टी मेंबर्स आल्सो गॉट फर्स्ट टाइम प्रोजेक्ट फ्रॉम आईसीएमआर. तो कभी ना कभी वो फंडिंग आपको जरूर मिलेगी और एक एवेन्यू नहीं है, आप ढूंढने जाओ आपको फंडिंग मिलती है. एनीबडी रिकॉग्नाइज दिस मैन? नाम पता है किसी को? नहीं पता. ये वॉरियर्स हैं, ये है एक्सीलेंस इन रिसर्च, इसको मैं कहता हूं एक्सीलेंस. ये है दिलीप मैलनबीस who discovered ORS and used it in 1971 war. ये एक ऐसा इन्वेंशन है, मुझे अभी भी लगता है कि इसको नोबेल प्राइज से ज्यादा भी कुछ है तो वो मिलना चाहिए था. करोड़ों जिंदगियां जिस चीज ने बचाई हैं, दिस इज द ट्रू इम्पैक्ट ऑफ रिसर्च. सो दिस इज हाउ वी डोंट नो आगे क्या इम्पैक्ट होगा नहीं होगा, लेकिन कुछ थोड़ा सोच के चलेंगे. उसने सिर्फ ये सोचा था कि मुझे ये जो इतने रिफ्यूजीज आ रहे हैं, यहाँ कॉलरा फैल रहा है, इनकी जान बचानी है, किसी तरह से वो डिहाइड्रेशन करेक्ट करना है. वो बाल्टी में भर के कैसे भी करके उन्होंने किया, विच पेव्ड द वे फॉर दिस मैग्निफिसेंट डिस्कवरी दैट वाज फाइनली देयर. देयर मल्टीपल क्राइटेरिया प्रोसेसेस. इम्पैक्ट फैक्टर जर्नल का होता है, एच फैक्टर इंडिविजुअल का होता है. सर ने एक नया स्केल निकाला. दोज हु आर इंटरेस्टेड you can read about it, the ICMR IRIS scale, that is the impact of research innovation scale, जिसके हिसाब से he has coined a currency for the credit for publication equivalent. Those who are interested can go through this. But मुझे ये लगता है ये सारे क्राइटेरिया प्रोसेसेस एक तरफ है क्योंकि वो, और दूसरा है जो रिसर्च का इम्पैक्ट है जिससे देश कि जनता को कुछ असर पड़ रहा है, वो अपनी तरफ है, उसकी बराबरी कोई भी इम्पैक्ट स्केल नहीं कर सकता. फॉर द फैकल्टी, हाउ टू मैक्सिमाइज योर रिसर्च इम्पैक्ट? चूज अ डेडिकेटेड फील्ड. इधर उधर हाथ नहीं मारना कि थोड़ा ये कर लिया, थोड़ा बी कर लिया स्पेशलिटी, थोड़ा सी कर लिया, डी कर लिया. एक चुनिए और उसके ऊपर लगे रहिए. दिस वॉज टॉट टू मी बाय माई मेंटर प्रोफेसर के.एन. अग्रवाल एंड देन डिसेमिनेट वाइडली. सो दिस वॉज जस्ट आई गिव एन एग्जाम्पल. विटामिन डी जब हमने शुरू किया काम तो कोई इसके बारे में इतनी हवा थी विटामिन डी की, आज भी हवा है, बहुत ज़्यादा है, लेकिन उसके बारे में क्लैरिटी नहीं थी. एंड दीज आर द, सो वी we thought to publish or to work in this area, and there were so many publications coming out of it. And they are good publication. But आप देखोगे इसमें से जो maximum we have published, 90% in Indian journals, though they would have been accepted anywhere because we wanted to disseminate, this was relevant to our country. So don't go by the impact factor always, कि नहीं मुझे अच्छे जर्नल में छापना है, मेरा impact factor अच्छा है, मेरी scoring बढ़ेगी. Sometimes you publish not for yourself, you publish for dissemination. You publish so that the public reads it, the scientists read it of your region and it apply it to their practice. And this finally paved the way for the IEP recommendation on vitamin D. This is another publication. We did another research area we did was in severe acute malnutrition. So just to show, because it also had a major impact, and finally we were able to establish this concept of nutritional rehabilitation centers in India, which is now being taken all over the India. I don't need to say much about the research ecosystem. Sir has already highlighted, you have an excellent research ecosystem. मैं जब एम्स के अंदर घुसूँ, आज मैं घुसा, तो मुझे दिखाई दिया 4th रिसर्च डे. ठीक है, तो हो सकता है वो रिसर्च डे का पोस्टर, बैनर आज रहे, कल रहे, 2 दिन पहले से था, 2 दिन बाद तक रहे. लेकिन मुझे साल भर कुछ ना कुछ दिखाई देना चाहिए. ये जो जिनको आज अवार्ड मिले, इनकी फोटो घुसते ही अगर एम्स के फ्रंट में सबसे ऊपर कि द बेस्ट रिसर्चर स्टूडेंट ऑफ द ईयर, सबको लगेगा मैं यहाँ जाऊँगा, मेरा भी यहाँ इसकी जगह नाम होना चाहिए. सो आई वॉन्ट दैट काइंड ऑफ रिसर्च इकोसिस्टम की एक घुसकर लगे कि हाँ एनवायरनमेंट है रिसर्च का और यहाँ रिसर्च को फॉस्टर किया जाता है. आई थिंक आई एम हो गया सर टाइम, बंद कर दूं? सर कह रहे हैं कर दो. सर को पता नहीं है कि टीचर है, वो अपना माइक जब मिल जाता है छोड़ता नहीं है. Okay, I'll just few interesting slides. Again, the importance of planning, importance of devising a research question. Honesty, collect data honestly. Collaborate, networking. जैसा मैंने कहा, STS मिला नहीं मिला फर्क नहीं पड़ता, काम करना है तो करना है. Avoid unethical practices, embrace challenges, persistence चाहिए, perseverance चाहिए. Setback होंगे, लेकिन उससे रुकना नहीं है. पेपर रिजेक्ट होंगे. I have published more than 300 papers. एक भी पेपर ऐसा नहीं था जो पहली बार में पब्लिश हो गया हो. हमेशा लंबे कमेंट्स आए, कभी 30 कमेंट्स, कभी 40 कमेंट्स, कभी 50 कमेंट्स, एंड कई बार बहुत बार रिजेक्शन भी हुआ. ऐसा नहीं है, आज भी पेपर मेरे रिजेक्ट होते हैं. सो गेट यूज्ड टू रिजेक्शन. आज अभी की जनरेशन को तो समझाना और अच्छा है, बिकॉज अभी तो ब्रेकअप का जमाना है. हमारे ज़माने में ब्रेकअप नहीं था, फिर भी हमने रिजेक्शन एक्सेप्ट करना सीख लिया. So medical research is a slow birthing process, stimulates lateral thinking, problem solving. लेकिन वही मैंने कहा, once you get your first one done, it's sort of addictive. वो नशा लग जाता है, वो चुल लग जाता है, और वो चुल आपके लिए अच्छा हो या ना हो, देश के लिए वो बहुत अच्छा है. Thank you so much. I am really thankful to all my mentors and institutions where I have worked. And this is my final message, that research is definitely possible and feasible in all settings. सोच बदलो, देश बदलेगा. Thank you. Thank you very much.
Thank you, sir, for such an insightful and thought-provoking keynote address. We now proceed to faculty awards with the felicitation of faculty members for their outstanding contribution to research, academic, and clinical excellence. To announce and confer the faculty award, I again invite Dr. Shamna to kindly proceed for faculty award announcements.
So this is the session 2 of the award ceremony. So in session 1, we acknowledge the hard work and the academic excellence of our students from AIIMS Bhopal. We now move on to the mentors, that are the faculty who are the core and backbone of the research environment in an academic institution and who actually reflect the research culture in any institute. So for the award category for Best Published Paper for Faculty, in the preclinical category, for each category there are 2 awardees. I'll first call upon Dr. Jitendra Singh from Department of Translational Medicine for the Best Paper Award in the preclinical category. Big round of applause, please. I next call upon Dr. Ashwin Kotnis from Department of Biochemistry for the second best paper in the preclinical category. So now I call upon from the paraclinical category, Dr. Abhinav Singh from Department of Dentistry for the Best Paper Award. Followed by Dr. Ankur Joshi for the second Best Paper Award from Department of Community Medicine. Big round of applause. Students, you have to keep on applauding because they are all your teachers and they have been mentoring you. So for the clinical medical category, I now call upon Dr. Mahesh Maheshwari to receive the award on behalf of Dr. Amber Kumar from Department of Pediatrics. Dr. Amber Kumar could not make it to here because of unavoidable circumstances. Big round of applause for the best paper for Dr. Amber Kumar. I next call upon Dr. Ankit Jain from Department of Surgical Oncology for the second Best Paper Award in clinical category. So, moving on to clinical surgery, with extreme delight, I call the name of my fellow colleague, Dr. Gunjan Chokse, who is walking up onto this stage for the 3rd time. She's created a hat trick of receiving Best Paper Awards. This is the 3rd consecutive year she's receiving it. A big round of applause for her. I call upon Dr. Shaila Sidham from Department of ENT for the second Best Paper in the category of clinical surgery. Big round of applause for Madam, please. For nursing, I call upon Dr. Nasima Shafkat. This is Madam's second consecutive year of receiving the Best Paper Award from Nursing Department. Big round of applause for her. So we move on to the next category, that is systematic review and meta-analysis. And for that, the best paper goes to Dr. Kumar Madhavan from the Department of Neurosurgery. Big round of applause for Dr. Kumar Madhavan. For the second best paper award for systematic review and meta-analysis, I call Dr. Megha Katare Pandey from Department of Translational Medicine. Big round of applause for Madam. In the Best Paper Awards, we have the narrative review, and for that, I would like to call upon for the best paper, Dr. Ashok Kumar from Department of Biochemistry, a very, very enthusiastic researcher, and this is Sir's second consecutive year of receiving a Best Paper Award. For the second best paper, I call Dr. Alpesh Goyal from the Department of Endocrinology for the category of narrative review. Big round of applause for Dr. Alpesh Goyal. So with that, we now move on to the second category of awards, which is for the intellectual property rights. It gives us great pleasure to announce a significant academic achievement of our institute. I now invite your attention as we recognize faculty members from AIIMS Bhopal for the patents granted for their innovative contributions. And for that, I would first like to call Professor and Dr. Debashish Bishwas, Head of Department of Microbiology, for his patent. Big round of applause for sir. I next call upon Professor and Dr. Rashmi Chaudhary, Madam, from Department of Biochemistry, for the patent that she has been granted. Calling upon the very dynamic and enthusiastic researcher, Dr. Anshul Rai, from Department of Dentistry, for his patent onto the stage. Big round of applause. From the Department of Anatomy, Professor Dr. Rekha Lalwani, for her patent. So from the Department of Anatomy, we have another patent, which has been granted to Professor Dr. Sunita Thavle, Madam. Many congratulations to you, ma'am. Big round of applause for our Associate Dean Research. So we have another category, that is the design patent, which has been granted to Dr. Vikram Vatti from Department of Cardiothoracic Surgery. Big round of applause for Dr. Vikram Vatti. Faculty awards stand as a recognition of the hard work, dedication, and unwavering determination of awardees towards advancing research. But that's not all. Our faculty are prolific writers, so we have now the session for unveiling of books. So for that, we now call upon Dr. Ashok Kumar from the Department of Biochemistry. Sir has edited the book on advances in cancer detection, prediction, and prognosis using artificial intelligence and machine learning. This book has come out from Springer Publications with co-editors Rajiv Nima and Dinesh Kumar Saini. I next invite Dr. Sumit Patil, Additional Professor from Department of Anatomy, to come forward to unveil the book authored by his esteemed colleague, Dr. Brijesh Kumar, who could not be physically present here today due to unavoidable circumstances. It's a textbook, an atlas on embryology, the second edition of it, a hugely popular book amongst undergraduate students. It is a publication from Wolters and Clover. So I next invite Dr. Sukesh Mukherjee, Additional Professor from Department of Biochemistry, to come up onto the dais for the unveiling of his book with Dr. Jagat Kanwar sir. Book title is Hypoxia and Tumor Microenvironment, Implications for Cancer Therapy. This is a Springer publication. Many congratulations to sir. Big round of applause, please. And last but not the least, please welcome Dr. Varun Malhotra, Additional Professor from Department of Physiology, to unveil his book, Clinical Physiology by SLC Publishers. So with this, we come to the end of the session 2 of awards, and I now hand over to Dr. Jay to carry the program forward.
Thank you, Dr. Shramna. We are honored to welcome our chief guest, Dr. Rajiv Bahel, Secretary, Department of Health Research and Director General, ICMR, to deliver AIIMS Bhopal Research Day Oration. I now request our Dean Research Sir, Professor Rihan, to introduce Dr. Rajiv Bahel.
So actually, sir doesn't needs an introduction, and अगर sir का introduction देना शुरू किया तो probably is going to miss his flight. So just to tell you all, sir, as of today is the Secretary of the Department of Health Research, and he's also the Director General of Indian Council of Medical Research. And I think I'm very, very privileged that sir is from the same medical college from where I was also a professor at one time. Sir has done his MBBS from the University College of Medical Sciences, Delhi. After that, he did his MD from Lady Hardinge Medical College, and then his PhD from AIIMS, New Delhi. So I think sir actually does not need an introduction, and I would like to welcome him to deliver the first oration at AIIMS Bhopal during the research day. Sir, the stage is all yours.
Thank you. So it's called an oration, but it will not be. It will only be a few things to try and help you to understand better what Indian Council of Medical Research is doing to promote research in India, a few things that your institute can do further. Many of this you will see that I have written you are already doing, and a few things that individuals can do to become more accomplished researchers. But before I start, I must congratulate AIIMS Bhopal. Some days you go somewhere, you really feel good. I am feeling delighted. I am so happy today. All that I have seen since the morning has given great hope to me that this institution is going to grow into one of the best research institutions in the country. Your trajectory is excellent. So Dr. Piyush said that one should do research. I do analysis all the time. So my first analysis that I have done is in each category of ICMR grant, you are taking 1% of the country at this moment. Whether it is STS, PG thesis, small or intermediate grants, you are getting 1% of all grants. Now you will say 1% तो अच्छा नहीं है, लेकिन ये सच नहीं है. AIIMS Delhi gets about 12% of all ICMR grants, almost 12%, 15%, something like that. PGI Chandigarh gets half of that, 6%. And after that, then there are only 6 to 8 other institutions that get 1 to 1.2%. So you should be actually pretty happy. You are actually in the top 10 grantees of ICMR, which is good, but you can see there is a lot more to achieve. Right? If AIIMS Delhi can get 12, 13%, you can certainly get 5, 6%. And then somebody said, we have done very well. I totally agree on the NIRF rank. And it's very good that your rank has gone up from 38 to then 31, and then from 31 to 25. So I thought I'll do a very quick analysis of what you have achieved and where you have achieved it. In simple terms, NIRF scores have 4 categories, 4 domains. First domain is teaching learning. Second domain is research and professional practice. Third domain is graduate outcomes. And fourth is outreach and inclusivity. So what do you think your score is? Your average score is around 70 something. But what is it in teaching learning? 81. 81 is actually pretty good, right? Highest maybe is 95 for Delhi AIIMS. So very good. teaching, learning. Graduation outcomes, 78. So you are producing a large number of graduates. Excellent. 78 is a good score. On outreach and inclusivity, slightly lower, but 70%. But what do you think you have? Any guesses on research? Anybody? Not this, not Dr. Saab, Dean Saab, but anyone from the audience, just shout a number. If you have 81, 78, and 70, what do you think you have on research? 90, okay. More? जोर से. 60, you have 34. Okay, 34. Now you will say, you can see where you can make the greatest jump. But nationally, you have to understand that other than AIIMS Delhi, there is nobody who scores 90. Other than AIIMS Delhi and PGI and one more, nobody is over 70. Most of the institutions, well-established institutions like CMC Vellore, JIPMER, all are in 50s, 50, 52. You are at 34. If you added 16 points to it, you will not be 25, you will be in top 10. So, आप देख सकते हैं 81 से 90 जाने में कितनी मेहनत लगती है, पर 34 से 50 तक आने में बहुत मेहनत नहीं लगेगी. तो रिसर्च एक ऐसी चीज़ है जो आपका सबसे जल्दी NIRF रैंक बढ़ा सकती है. ये मेरा शॉर्ट एनालिसिस है. यहाँ बैठ के अभी मैंने जो अपने फ़ोन पे देखा कि क्या स्कोर है. डॉक्टर साहब ने मुझे 34 दिया, मैंने कहा बाकी भी देख लेता हूँ. ठीक है, तो ये पहला मैसेज. दूसरा, पहला कि आप 1% ग्रांट ले रहे हैं ICMR की, यदि ये 2% भी हो जाता है तो आप देश के तीसरे इंस्टीट्यूट बन जाएंगे. You will be number 3. Today you are in the next range. You are in the next 6 to 8. But you do a little better, you will go to the next level. So that is my very quick thing on what your performance is. But the enthusiasm that I am seeing today, it will go beyond these results. Within the next 2 to 3 years, you will see that all these numbers will change. And if you continue to do this, of course, leadership is important, because if the director and the deans, etc., are saying research से क्या होता है, research बेकार है, उसका कोई मतलब नहीं है, time waste कर रहे हो, सिर्फ अपना patient care करो, वो तो बात बनती नहीं. तो ये मेरा आपको मैसेज है कि लीडरशिप का बड़ा इम्पॉर्टेंट है, लेकिन सर वो कह रहे हैं सोच बदलो. मैं कहता हूँ बहुत सारे लोगों की सोच बदलनी पड़ेगी, बहुत सारे लोगों को एफर्ट करना पड़ेगा. Not everybody, but a large number. Okay, I am going to show you a very short presentation of things that next. Many of this we don't need to show. I'll tell you a little bit about ICMR actions that have been taking place in the past 3 years. And I chose 3 years because I have been working at ICMR for 3 years and 3 months. So only I'm talking about this period. Before that, a lot has happened on which we have taken more concrete steps, but shorter memory. Next. So capacity building. We have increased all seats, like STS has increased to 2,000. You got some 20 something, so again 1%. We have now increased the PGs to 1,000. You got about 1%. We have increased all these numbers. I'm particularly proud of the PhD program for faculty. And I think this can be a game changer for our institutes. But I was not happy that you had only 2 candidates this time. We allow you 3, and you have 2. That means 1 was less. Some institutes get 6, because they are so good, the applications are so good, that we just cannot say no. Even though we say, तो जिसका एक आध कम होता है, हम फिर दूसरे इंस्टीट्यूट को दे देते हैं. तो आप ज़्यादा लेना है, 3 से कम नहीं लेना है. लेकिन अच्छा कर रहे हैं आप, और अच्छा कर सकते हैं. अगर आपका स्टूडेंट्स में इंटरेस्ट बढ़ रहा है, तो STS अपने आप बढ़ेगा, PG भी बढ़ेगा, और फैकल्टी का MD भी बढ़ेगा. नेक्स्ट. So all these things about research capacity, why I'm talking about PG thesis, I just want PG thesis. Why I'm talking about PhD for clinicians. This picture shows the number of clinicians who are PhDs in the United States. 3 out of every 100 doctors is a PhD. Every doctor. आप देखिए, आप एक साल में 1 लाख, आजकल हम 1,30,000 डॉक्टर बना रहे हैं. एक साल में 5-10 से ज़्यादा PhD नहीं बन रहे. अभी ये हमने 60 पर ईयर ये देना शुरू किया. We have a long way to go because we think that by doing a PhD, the faculty will feel more empowered because they would have spent hardcore time and learned methods also and got a degree in research, which will give them a little more motivation. Next. So I'm not going to talk too much about capacity, but I'm going to talk about this. You can see on the screen something which is of interest. वो मुकेश अंबानी की तरह भगवान से नहीं कह रहे, लेकिन पैसे बहुत बढ़ रहे हैं. भारत सरकार का इंटरेस्ट अनुसंधान में बढ़ रहा है और ICMR को ज़्यादा ग्रांट्स मिल रही हैं. यहाँ पे 2 कलर के हम आपको दिखाना चाहते हैं, लाइटर येलो एंड देन डार्कर ऑरेंज. If you go only about 8 years in the past, 170 crores was available to all institutes in the country from ICMR and 484 crores for ICMR institutes. Like what we have in Bhopal, we have BMHRC, we have NIRE Bhopal, we have NIRT, NIV, which are institutes that ICMR runs. रेशियो देख लीजिए, 170 करोड़ और 480 करोड़, लगभग 1:3. इस साल जो आएगा उसमें नंबर देखिए, 170 करोड़ 1,815 करोड़. दिस इज नॉट कवरिंग इन्फ्लेशन. इन्फ्लेशन से तो इतना नहीं पहुंचता, 1.5 गुना होता, 2 गुना होता. 8 साल में 2 गुना हो गया होगा इन्फ्लेशन से, ये 10 गुना है. तो अपॉर्चुनिटी कितनी बड़ी है ये आप देखिए. पिछले 3 साल में, 23 के बाद से 4 साल में, 23 में हमने पहला बजट किया था, 600 करोड़ लिखा है, उसको 1800 करोड़ 3 साल में 3 गुना करा है. ये सिर्फ इसलिए कि आप जैसे इंस्टीट्यूशंस के पास ज़्यादा अपॉर्चुनिटी हो. बट एज ए सम पीपल सेड मिलता नहीं है. अभी भी ऑब्वियसली एक टाइम था जब हम कम देते थे तो टोटल 500 एप्लीकेशंस आती थी, अभी 10,000 एप्लीकेशन आती है. बिकॉज पीपल नो दैट दे कैन गेट, सो मोर पीपल आर इंटरेस्टेड. सो कॉम्पिटिशन हैज इंक्रीज्ड, दैट इज फाइन, बट people are getting grants. I was very happy to see there were 20 new grantees. Maybe next year there will be 30 new grantees. So this is how, but it is extremely important to know that more resources will become available. If this trend continues, we will have in the next 5-6 years even more resource availability. Next. Second thing is, what are we funding? I was telling somebody in the director's office that when I took over, about 75% was simple descriptions of something which was burden of disease or some mechanism, something, some paper describing A, B, C, D. All under descriptive research. 75%. Only 25% was being spent on discovery or development or delivery research. Today, we have converted it into more equity, more equal distribution. You can see small grants, intermediate grants, large grants. You are seeing more discovery and development compared to what we are seeing in terms of descriptive research. Next. Same pattern you can see for the last year. Next. So you also know, I don't need to tell you, you have almost everything. You have MRU, you have VRDL, you have a HTA resource center. I don't think you have a center for guidelines, but you could get one. You are easy. You have Diamond Center. So usually I show this to institutions to say, आप apply कर सकते हो, आपके पास already है. अब आपको मैं कहता हूँ आप इसको और better use कर सकते हो. You have all these DHR schemes. You need to do, you can use them better. Next. These are two things that I want to show you, MedTech Mitra and Patent Mitra. So what we found is that many of our innovations were not reaching the end. They were falling into valleys of death. And I was asked by our minister and by Niti Aayog, can we create a mechanism, can we create a system to support our innovators in the country to bridge some of these valleys, build a highway on these valleys. So for that, we created in partnership with CDSCO, which is very, very important. For the first time in the history of this country, probably history of any country, we have the apex body on research and the apex body on regulation sitting together and supporting the innovators from the beginning to get a strategy. So if you are an innovator, you must apply and get advice. Sometimes only reading yourself, you don't get everything. But एक आपको एप्लीकेशन डालना है, एक मीटिंग करना है, आपको ये बता देंगे रेगुलेटर कि किस तरह से इसको हमें रेगुलेटरी स्ट्रैटेजी बनाना है. उसके अलावा वी हैव क्रिएटेड प्री क्लिनिकल एंड क्लिनिकल facilitation. Anything that you need in large animals, because those are usually small animal facilities are available everywhere. But large animal facilities are not available. We can make them available. We have now a full institute at Hyderabad called NARF, National Animal Resource Facility, that can do these trials for you to get regulatory approvals, toxicology studies, etc. Similarly, we have a clinical trial network called Intent. You are also a member of that, which is excellent. But the idea is they can do clinical trials which can get approvals of, because these are some of the things which look easy for some people, but are extremely difficult for our colleagues. If there is, I know there is at least one person from Indian Institute of Science, from bioengineering, and when they think of clinical trial, they shudder, because they think, ये कौन करेगा? ये कैसे कराएंगे? तो ये पार्टनरशिप में अगर करेंगे तो बहुत ईजी है. डिफिकल्टी है अगर अलग अलग करेंगे तो इस तरह से कई बार प्रोडक्ट बन जाता है, लेकिन उसको कोई खरीदता ही नहीं है क्योंकि कोई गाइडलाइन नहीं है. तो हमने एक वर्ल्ड क्लास गाइडलाइन डेवलपमेंट सिस्टम DHR में बनाया है, जिसको हम सेंटर फॉर गाइडलाइंस कहते हैं, विच इज़ फॉर द एंटायर मिनिस्ट्री. सो DGHS, Ministry of Health, Department of Health and Family Welfare and DHR, both the departments of the ministry have got together, and there is going to be only one Ministry of Health guideline, ICMR, DHR, everybody together. And this guideline is being made by a evidence-based process which is at par with WHO and NICE UK. And the idea is that the guideline that India does should be evidence-based. And attached to it, just like NICE UK, they have Center for Health Technology Evaluation. We have Health Technology Assessment India as an attached office to DHR, which does cost effectiveness. So guideline plus cost effectiveness makes it easy for people who are procuring. So state governments are very interested in getting HTA. जो HTA का हम वो देते हैं उनको recommendation कि ये cost effective है, ये इतने price पे आप खरीद सकते हैं. उसके ऊपर बहुत सारे लोगों ने कई नई innovations को procure करना शुरू कर दिया. तो ये एक ऐसा, ये सारा highway है. ये सभी problem हैं, not सिर्फ एक चीज़ को बनाना और उसको रेगुलेटरी अप्रूवल लेना ज़रूरी है, बल्कि उसको उसको खरीदना भी तो किसी को पड़ेगा ना. और हमारे देश में गवर्नमेंट इज ए बिग प्रोक्योरर. Private sector is also a procurer, but they can also benefit from a good HTA. Next. And I've given numbers below that 570 innovators within about a 2-year period, which means almost one per working day, has been helped in making either the strategy or going through different parts of the ecosystem. You can see the numbers of each. I follow these numbers on 2 weekly basis to see कि ये number बढ़ रहे हैं कि नहीं बढ़ रहे. Next. पेटेंट मित्र. पेटेंट मित्र में नाम से लगता है सिर्फ पेटेंट करने के लिए है, पर 2 पार्ट है, एक ब्लू और एक ग्रीन. ये 2 लिखे हुए हैं ऊपर, देख लीजिए. पेटेंट फैसिलिटेशन, ये क्या है? हर इंस्टीट्यूट में अपनी पेटेंट किसी में थी, किसी में नहीं थी. कोई कैसे करोगे? हाउ विल यू गेट? वी हैव क्रिएटेड वन ऑफिस दैट हैज़ 10 अटर्नी टीम्स. 10 अटर्नीज को हमने, फर्म्स को वी हैव एम्पैनल्ड, एंड वी विल गेट ए पेटेंट फाइल्ड इफ इट इज़ पेटेंटेबल. इफ इट इज़ नॉट पेटेंटेबल वी विल टेल यू कि हमें नहीं लगता कि ये पेटेंटेबल है. तो ये पार्ट 1 है. पार्ट 2 है उस पेटेंट को. पेटेंट मैंने सुबह बता रहा था लोगों को, इज नथिंग बट रिंग फेंसिंग एंड सेइंग नोबडी शुड यूज दिस until I say so, because then I want to use it. I want to have the right to use it, or I will give this right to somebody. That is a patent. But how do you give the right if you don't get anybody to give it to? हम कहते हैं हमारे पास पेटेंट है, हम किसको दें? जब मैं इंडस्ट्री से पूछता हूँ वो कहते हैं हमारे देश के में टेक्नोलॉजी नहीं है, अमेरिका जाके टेक्नोलॉजी लानी पड़ती है. तो ये बीच का रास्ता जो ढूंढने के लिए दोनों के बीच में हमने ये सेकंड चीज की है, जो टेक्नोलॉजी ट्रांसफर फैसिलिटेशन. These both are part of patent method, and already we have about 127 applications. This was started very recently, within the last year. We have 127 applications, of which 70 have been filed. Plus, today, to date, more than 20 technologies have been transferred to industry. Next. ये बड़ा कई लोगों ने पूछा मुझसे, क्या पॉसिबल है, क्या हम आईआईटी की तरह एंटरप्रेन्योरशिप स्कीम्स नहीं कर सकते, क्या हम अपने स्टार्टअप नहीं बना सकते, क्या हमें कुछ इसमें फाइनेंशियल बेनिफिट नहीं मिल सकता. एक्चुअली दिस पॉलिसी इज अप्रूव्ड. इट हैज़ बीन अप्रूव्ड बाय आवर मिनिस्टर, नॉट नाउ, इन 2022. It is called the OLIVE, Institutes Establishing Office of Licensing and Innovation Entrepreneurship. And the entrepreneurship policy for medical professionals clearly states that you can do it. There is no problem. However, implementation requires your approvals of your GBs and everything. So now AIIMS New Delhi, in about a month ago, got an approval for their entrepreneurship policy, as well as setting up a Section 8 company through which they can do this kind of technology. And I think it is worth an experiment that you want to do, because otherwise the Indian Institutes of Technology, the Indian Institute of Science, everybody else has this kind of policy, and they can do their startups, etc. But we can't. So I want to see a day when a medical college, a medical student will decide, मैंने कर लिया MBBS, मैं तो entrepreneur बन गया, मेरा 100 करोड़ का मेरी कंपनी शुरू हो गई, या मेरा $1 billion का मेरा बिजनेस है. I want to see that. That will happen. It's not impossible. It is very much possible. You can see we have unicorns which started with almost nothing, and they are more than $1 billion worth today. Small labs, small startups. India is the fastest growing startups, but I think the medical colleges have been left behind. And I would really encourage you to keep taking it to your GBs until it is approved. Because everybody is in agreement. Minister of Health I can personally vouch. I have spoken with him, with Honorable HFM, with Nadda ji. He is totally positive to this. He said, why not? If IITs can do it, why should AIIMS not do it? Why should PGI not do it? Why should other colleges not do it? Let us start with all AIIMS and at least a few AIIMS and PGI. Jodhpur has done it already. So why not Bhopal? What is stopping you? Nothing. Only a little bit of push is required and it will be done. Next. This is your status. In total, from about in 10 years, you got from 2013 to 22, 13 crore rupees from ICMR. And in the past 3 years, you have got, I think this year is not included, you've already got 14 crores, but plus, I think this year's grants. So 25, 26, I think is not included. So it is increasing. It has increased. But is it enough? Absolutely not. Next. Now, this is what ICMR can do. We can create systems like policies, like entrepreneurship policy. We can create initiatives like Patent Mitra and MedTech Mitra. We can give you guidelines on ethics, on different things, like we have guidelines on ethics. On Roli Mathur is sitting here. She is helping us to create different types of guidelines, whether it is for AI in research, health research, or whether it is for stem cell and gene therapy, whether it is for multicentric studies, etc. Policies, funding, hand-holding through Patent Mitra and MedTech Mitra. That's our job. But we expect eventually institutes to do something. And this is my generic slide, but you will see you have almost done all of it. Expand and enhance intramural research grant. If you are giving 5, 10, 15, 20, you gave 25 to faculty, I think, but you have 250 faculty. It means only 10% of faculty get the grant. Can we increase to 20% as a target? At least 20% of faculty get interested in research and get an intramural grant. It will enhance the numbers. When you get more numbers with high quality, you will also get more output. Second thing is, I have said this, you have shown it. Instead of only giving value to number of research papers, an H index, if you give value to impact of research, has it been useful? So when I show you the IRIS scale, Dr. Piyush Gupta talked about it, the way I have thought about it is one order of magnitude difference. If one publication is 1, then one publication that leads to a new clinical, kind of new clinical care algorithm is 10. One order of magnitude, 1 0 more. 1 10 10 times more. आइडिया ये है कि अगर एक इनोवेशन बनाया तो 5, लेकिन अगर आपने उस इनोवेशन, उस पेटेंट को कमर्शलाइज किया तो 20 पेपर के बराबर मानेंगे. So the whole idea is for institute to also recognize that all awards are not the same. A narrative review is not the same as the same type of medal should not be given, in my view, to person who writes a review or a paper versus one who does something, innovation that is used. You should maybe create 2 size medals, 10 times bigger medal or a shield. So idea is, लोगों के मन में ये आना चाहिए कि मैंने अवार्ड तो जीता, लेकिन छोटा अवार्ड जीता अगर सिर्फ पेपर लिखा. अगर उस पेपर को से क्लिनिकल केयर बने बदली गाइडलाइन या पब्लिक हेल्थ केयर को चेंज किया, तो मुझे उससे 10 गुना ज़्यादा रिकग्निशन मिलेगा. अगर मैंने एक टेक्नोलॉजी बनाई जो लोगों तक पहुंची, तो 10 या 20 टाइम्स ज़्यादा है फ्रॉम राइटिंग ए पेपर. दिस इज ओनली possible for the leadership of the institute to do. ICMR can give its guidance, but we cannot force anybody to do that. Then there is one thing that everybody cries for: more time. Now, this is something which is very difficult in India. We go to Harvard, a student went, somebody goes, you think, oh, वहाँ पे तो इतना time मिलता है research करने के लिए. वो बात सच है. लेकिन हमारी प्रॉब्लम है, हमें 1.4 बिलियन लोगों को क्लिनिकल केयर भी देना है, सर्विसेज भी देना है. तो ये बहुत मुश्किल है कि आपको प्रोटेक्टेड टाइम मिलेगा रिसर्च के लिए. बट एटलीस्ट द वंस हु आर हैविंग समथिंग रियली, वी आर एट एज, you can think about maybe 5%, 2% of the faculty to reduce their clinical duties or their teaching duty, to give them a little more time towards completing that research that is important. Make a humble beginning. That's all I am asking. You have already got a central research laboratory. You already said your only job is ease of doing research. So I think you are, that is why I am enthusiastic about your institution. And operationalize the entrepreneurship policy. Policy is there, we have already spoken about it. Next. Now I am speaking to all of you. What can you do to enhance research? First and foremost is more faculty should conduct impactful research, not research to get a tick box. हो गया, कर लिया. आपको कई बड़े सिंपल एग्जाम्पल दिए डॉक्टर पीयूष ने, लेकिन हर एक एग्जाम्पल के पीछे एक यूजफुलनेस छुपी थी. टीवी देख के भी रिसर्च किया तो एक बड़ा इंपॉर्टेंट मैसेज गया कि देखिए कंपनीज जो हेल्दी फूड्स की कोई नहीं कर रहा, बच्चों को सिर्फ अनहेल्दी फूड दिखाए जा रहे हैं. उसको एक्शनेबल है वो, राइट? छोटी सी बात है पर उसका इम्पैक्ट है. मुझे छोटी बड़ी की बात नहीं है. Just saying that we have published something which is in a paper, there are only two things I ask. Either do something that makes India proud. आप कहिए हमने नया ग्लैंड बनाया, वेरी गुड, नया ग्लैंड ढूंढा है. हर जगह नाम आएगा जब उस ग्लैंड का, तो एक भारतीय टीम का नाम आएगा, एक भारतीय इन्वेस्टिगेटर का नाम आएगा. It will make us proud. Very good. Or, so either you do something which is first in the world, makes India proud, do something which people will say, this is from India. Then, perfect. Or, you do something which is even more important, which is do something which helps the people of this country, helps our citizens. Research that helps our citizens. Now, many times we train our students and PGs and everything on doing research that is hardly of any use to anybody. And they get used to thinking कि ऐसे ही होती है रिसर्च, सिर्फ अवार्ड लेने के लिए होती है. तो वो नहीं है. हमें रिसर्च करना है to get impact. That is my first thing. And more people get hooked on that, get that inner passion to do it. वो जो डॉक्टर साहब कह रहे थे, आदत लग जाए किसी को अच्छा काम करने की, तो वो बहुत फिर वो उसको रहा नहीं जाता उससे कुछ किए बिना. Secondly, focus on discovery and development and patents and other things which we don't usually do. We generally keep on describing things that I have described and maybe it will be used one day. Yeah, I'm saying we should do basic research, definitely. But do research which is really has either a potential to change something in the future or can change it today. Focus on high impact publications. So my boss taught me, when I learned, my mentor was Dr. M.K. Bhan, and he told me every time you think about a new project, just like Einstein was saying, think about the question for 55 minutes. But out of that 55 minutes, he said, 15 minutes तो यही सोचो कि क्या ये इस लायक है कि मैं अपना 5 साल लगाऊं उसमें? Is it worth the biggest cost? You might think that getting a grant is the biggest thing. No. You get a grant for something which is not actually very big. It is a waste of your life. Because एक आदमी के पास कितनी वर्किंग लाइफ होती है? जब तक हम फैकल्टी बनते हैं हम 35 साल के लगभग हो जाते हैं. 30 साल होता है उसके बाद 65 पे रिटायर होने के लिए. 30 इयर्स में आप कितने प्रोजेक्ट कर लोगे? अगर पैरेलल में भी 2 करोगे तो आप 10 प्रोजेक्ट कर लोगे अच्छे. हाई क्वालिटी 12 कर लोगे, 15 कर लोगे, कोई बहुत प्रोडक्टिव होगा 20 कर लेगा. तो एवरी प्रोजेक्ट इज 5 to 10% ऑफ योर लाइफ. You want to waste it on something that is. So he told me, पहले लिखो और सोचो कि ये इसकी क्या यूज होगी जो मैं कर रहा हूं. अगर इसका इम्पैक्ट ही नहीं कुछ होने वाला तो छोड़ दो, किसी और को करने दो, कोई और कर लेगा. आप वो काम करो जो कि आपकी लाइफ के लायक हो, आपके 5 साल 3 साल लगाने के लायक हो. That is the meaning of this. I think international collaborations, lots of international collaborations where we are just giving data. We are not even thinking anything. प्रोजेक्ट भी नहीं सोचा, कुछ भी नहीं सोचा, बस सिर्फ डेटा कर दिया तो हम मल्टी सेंट्रिक स्टडी के पार्ट हो गए. ऐसे बहुत सारे प्रोजेक्ट मैं रोज देखता हूँ, सारे एम्स से आते हैं, यहाँ से भी आते हैं, कि इंटरनेशनल कोलैबोरेशन कर रहे हैं, लेकिन हमारा इंटेलेक्चुअल रोल है ही नहीं किसी इंटेलेक्चुअल कोलैबोरेशन में. तो इंक्रीज करिए, आप करिए इंटरनेशनल कोलैबोरेशन, बट ऑल्सो थिंक अबाउट how to increase our role in international collaborations. Important industry partnership. I have said this to several people that we think industry is we are grown up, at least हमारे age के लोग, we grew up in that thing about where we used to think there is some monster in private sector and government sector हम दूध के धुले हैं. ऐसा सच नहीं है. इंडस्ट्री में भी उतनी करप्शन है, उतने खराब लोग हैं, उतने अच्छे लोग हैं, गवर्नमेंट में भी उतने अच्छे लोग हैं जितने वहाँ हैं, लेकिन बिना इंडस्ट्री के कोई प्रोडक्ट आपके पेशेंट तक नहीं पहुँच सकता. मैं डॉक्टर साहब से पूछ रहा था, एक चीज़ बता दो जो आप किसी अच्छे से अच्छे एकेडमिक इंस्टीट्यूशन से खरीदते हो. गिव मी वन ड्रग, वन डिवाइस, वन वैक्सीन दैट यू बाय फ्रॉम एम्स न्यू दिल्ली. हार्डली एनीथिंग, probably zero. You buy everything from a company, international or national. So eventually तो कंपनी नहीं बनाना है, तो उनसे कोलैबोरेट ही नहीं करेंगे तो बनेगा कैसे. तो वो भी जरूरी. इंडियन पब्लिकेशंस, डॉक्टर साहब ने इतना कुछ बताया. साइट रेलेवेंट पब्लिकेशंस. सी सेल्फ साइटेशन बहुत ज़्यादा नहीं करना चाहिए. अपने साइटेशन करोगे तो वो तो लोग आपको नंबर कम दे देते हैं, पर कम से कम ये तो करो कि अगर इंडिया में अच्छे पेपर हैं, हम फिर भी वही ढूंढेंगे लांसेट वाला पेपर, चाहे हमारे से ना रेलेवेंट ना भी हो, हम कहेंगे वो वाले को करते हैं, अपने वाले को छोड़ो. ये तो आईजीएमआर में ना सिर्फ पब्लिश करो, मैं तो कहता हूँ साइट भी करो अगर वो रेलेवेंट है तो. नहीं तो हम कैसे आगे बढ़ेंगे, फिर तो हम लोगों के पीछे ही रहेंगे. वी विल बी फॉलोअर्स नॉट लीडर्स. नेक्स्ट. This is what I talked about, the publication equivalent. You can read this scale. Only one idea. It's not a perfect score at all. There is nothing. The only thing it tells you is give more weight to the impact of things rather than to just publishing it. Next. Here are 10 things who wants to be a hardcore researcher. Why do I share these 10 things? These are the 10 things I learned over 10 years. That is what Dr. Bhan told me to do. And I diligently learned each one of them. And I can tell you, I can talk to the best in the world on any one of these and I can get by. I know enough to talk to the best people in the world on any one of these because I have done all of this with my own hands. All of this. Good because I was not doing clinical work. I was 10 years only learning research. You may not be able to do all 10. But the more things you can do out of this, the better researcher you become. The first two are kind of the most critical. Firstly, methods. Anybody who does not know methods is like blinded. You are already handicapped and you are running, right? You don't know what you are, where you are going. Because you may have a very smart question, but you have very poor methodology. Learning methods is number one. We don't learn those methods in MBBS. We don't learn them in MD. We hardly ever, अभी बड़ी मुश्किल से फैकल्टी को एक बेसिक कोर्स कराना पड़ता है, वो भी लोग चीटिंग करके पास होते हैं. सच बात है कि वो जो बेसिक कोर्स होता है ना, वो जो रिसर्च मेथड्स का NIE वाला, वो भी वो किसी तरह से उसको स्कैम करके पास करने की कोशिश करते हैं. अगर हम मेथड नहीं सीखेंगे तो आगे कुछ नहीं है. मेथड तो सीखना पड़ेगा. आप लोग बोलते हो मेरा प्रोजेक्ट सेलेक्ट नहीं हुआ. मैं आपको बोलता हूं कि आपका प्रोजेक्ट की जो नॉन सिलेक्शन का 80% कारण होता है वो पुअरली रिटन मेथडोलॉजी होती है. मेथड अच्छे से लिखा ही नहीं होता, सोचा ही नहीं होता, नॉट थॉट थ्रू एंड नॉट रिटन वेल. You may have it in your head, but doesn't matter because people are going to read the proposal that you send. So if you know good methods, both qualitative and quantitative, that changes everything in terms of your capacity and your success and your strike rate. But even more important, I think, is critical thinking, conceptualization, writing a proposal and a protocol. It is about taking a problem and converting it into something that is answerable by research. That is the key. Other than that, there are lots of skills, lab skills. You may think I'm a clinician. I'm a pediatrician. But I have done with my own hands hundreds, sometimes thousands of samples, biochemistry, microbiology, biotechnology, name it. I have done it in our own AIIMS labs. All of these samples by myself may not be more than one study, but at least once. I have done it with my own hands, and it today, up to today, जो मैंने किया था 1990s में, लेकिन आज तक it is helping me because some understanding of lab. Bioethics. डॉक्टर रोली ने ऑलरेडी क्लास ले लिया है तो मैं कुछ उसमें कहूँगा नहीं, लेकिन ये सीखना पड़ता है. आपको प्रिंसिपल्स नहीं आते हैं, आपको समझ में नहीं, इश्यूज समझ, तो फिर बायोएथिक्स में 2 लाइनें लिखते हैं. वी विल टेक अप्रूवल फ्रॉम एथिक्स कमिटी एंड वी विल राइट एन इन्फॉर्म्ड कंसेंट. पीरियड. हो गया मेरा section on bioethics of my proposal. So you will not get good grade from the ones who are looking at the proposal. So you have to show you really understand what are the ethical issues in conduct of research and how will you mitigate them, how will you tackle them as you plan your study. Implementation, आपने दिखाया पीयूष जी ने कि both rigor and honesty are critical. लोग सोचते हैं हमने स्टडी प्लान कर ली, पैसे मिल गए, काम खत्म हो गया. काम शुरू होता है तब. 3 साल गधा मजूरी करनी पड़ती है. You have to really work like a donkey on a project if you really want high quality data. डिजाइन करने में तो बहुत मजा है, एनालिसिस में भी मजा है, पब्लिकेशन में भी मजा है, पर जो 3 साल बीच की मजदूरी है वो भी बहुत जरूरी है. ना मजदूरी करोगे ना अच्छा पेपर निकलेगा, ना समझ में आएगी, ना आपको अपनी फाइंडिंग्स पे खुद भरोसा होगा. तो ये वाला पार्ट भी सीखना पड़ता है, अपने आप नहीं आता है. आपको लोग बेवकूफ़ भी बनाएंगे, आपका स्टाफ भी बेवकूफ़ बनाएगा, आपके फील्ड वर्कर भी बेवकूफ़ बनाएंगे. अगर आपको समझ नहीं है तो आप नहीं कर पाओगे. अपने हाथ से डेटा कलेक्ट नहीं किया जिसने, उसको किसी को भी समझ ही नहीं आएगा कि कोई और कैसे करता है. मैं दिल्ली के स्लम्स में जाके मैंने घरों में खुद डेटा कलेक्ट किया, खुद मॉनिटर किया, खुद सब उसको देखा है, तब मेरी समझ में आया कि एक्चुअली डेटा में इश्यूज कहाँ होता है. डेटा मैनेजमेंट, एनालिसिस, इंटरप्रिटेशन. लोग सोचते हैं कि ये फार्म आउट कर दो किसी स्टैटिस्टिशियन को. स्टैटिस्टिशियन बोलता है पीआई बताएगा क्या करना है, तो ना आप बताते हो ना वो करता है, तो बीच में गंदा मंदा एनालिसिस हो जाता है. जिसको ये पार्ट नहीं आता वो पूरा रिसर्चर कैसे बनेगा? इट इज लाइक सेइंग आई हैव लर्नड सर्जरी बट आई विल नॉट नो माय इंस्ट्रूमेंट्स. मुझे इंस्ट्रूमेंट नहीं सीखना, मुझे तो सर्जरी करना आता है. वो भी तो सीखना पड़ेगा ना, हर पार्ट को सीखना पड़ता है. दिस इज ए क्रिटिकल पार्ट. अनलेस द पीआईज एंड इन्वेस्टिगेटर्स आर पार्ट ऑफ द रिसर्च टीम, अगर आपको समझ ही नहीं आ रहा वो क्या कर रहा है स्टैटिस्टिशियन, इतना तो सीख लो कि समझ में आ जाए कि वो क्या कर रहा है, तभी आप आगे बढ़ोगे. कई बार सारी चीज़ें नहीं सीख पाओगे, मुकम्मल रिसर्चर नहीं बनोगे, पर एटलीस्ट 3 लोग मिलके मुकम्मल बन जाओ, किसी को कुछ आता है, किसी को कुछ आता है, तो अपनी टीम ऐसी बनाओ कि जो ये चीज़ें कर सके. Systematic reviews, meta-analysis, understanding work and working with public health programs, community engagement and costing and cost effectiveness. I have not written it just as words. I have told you I actually slogged for 10 years to learn these 10 things and applied them for the next 30 years. Only then I can tell you that I know something about research. So please work hard on this. That's it. Thank you. Next slide. Last one. Follow your heart. Follow your passion. Don't try to make something that एक ही रास्ता, एक ही रास्ते पे जाना है. Students हैं, PMD students हैं, DM students. There is no one way that you will say. I love this quote. 2 roads diverged in a wood. I took the one less traveled by, and that has made all the difference. It applies to almost anybody who is exceptionally successful. अगर आप ट्रेडिड पाथ पे चलते रहोगे तो ट्रेडिड आउटकम ही मिलेगा. जो हिम्मत करता है अलग पाथ पे चलने की, उसको ही वैसा ही एक अलग आउटकम भी मिलने का चांस है. सबको नहीं मिलता है, लेकिन मिलने का चांस उसी को है जो रिस्क लेता है. अपने हार्ट को फॉलो कीजिए, सिर्फ ये मत सोचिए कि दुनिया क्या कर रही है. थैंक यू.
Thank you, sir, for such an inspiring and insightful address. We now request our Executive Director, Professor Dr. Madhvanand Kar, to kindly honor and felicitate our chief guest, Dr. Rajiv Bahel, by presenting a shawl and Shrifal. I request our Dean Academics, Professor Rajneesh Joshi, to kindly present the oration citation.
It gives me immense pleasure to introduce and welcome Dr. Rajiv Bahel. He has 30 years of experience leading international health research and translating research in public health policy in both India and at global level. His expertise includes setting the research agenda, conceptualizing and implementing health research to address key priorities, mobilizing resources, supporting and building capacity of research institutions to implement research studies with excellence and translating research findings into public health policy. His major achievements include impacting research which has potential of saving over 1 million lives every year, contributing to major innovations, particularly related to management of diarrheas, breastfeeding, treatments of newborns with severe acute malnutrition, kangaroo mother care, formulation of evidence-based global policy guidelines, and strengthening research capacity in more than 50 institutions across 20 countries around the world. So we are very proud to host you today, sir, and we hope that your cherished path will always be even more fruitful in years to come. Thank you very much.
We now request Executive Director Professor Dr. Madhvanand Kar to kindly felicitate the dignitaries by presenting a memento as a token of gratitude. First, to Dr. Rajiv Bahel, sir, and to Dr. Piyush Gupta, sir. Thank you very much, sir. We request everyone to take their seats on the dais. Before we conclude today's program, we now invite Dr. Sunita Athavale, Associate Dean Research, to kindly deliver the vote of thanks.
Respected dignitaries on the dais, our distinguished guests for the day, and my colleagues, students, and staff of AIIMS Bhopal family. On behalf of AIIMS Bhopal, it is my proud privilege to propose the vote of thanks on the occasion of the 4th Research Day. At the outset, we would express our profound gratitude to our chief guest, Dr. Rajiv Bahel, for graciously being with us today and for delivering the fourth research duration. Sir, your insightful guidance and on nurturing a vibrant research culture at AIIMS Bhopal is of immense importance to us and will continue to inspire us in the years ahead. We are equally grateful to our guests of honor, Dr. Piyush Gupta, sir. Sir, your thoughtful perspectives have greatly enhanced today's deliberations and motivated all of us present here, especially the undergraduate students. We extend our sincere thanks to our guest speakers and invited faculty for their scholarly contributions in today's deliberations. We also gratefully acknowledge the distinguished dignitaries from Bhopal and outside who graciously joined us and honored us on the occasion with their presence. I would like to place on record, on behalf of Research Cell, I would like to place on record our heartfelt gratitude to our Executive Director, Professor Dr. Madhavanandkar. Sir, it was your belief that scholarly work of the AIIMS Bhopal family should be celebrated on a much larger platform. And it is your guidance and perseverance that made it this meaningful celebration of the research at AIIMS Bhopal possible today. We gratefully acknowledge the collective efforts and support of all our deans, the medical superintendent, and their respective teams, whose cooperation across academic, clinical, and administrative domains enabled research to flourish at our institute. We also acknowledge with deep appreciation the invaluable support of Deputy Director Administration, Mr. Sandesh Kumar Jain, and his team, along with the engineering section and finance sections. Their constant coordination, campus support, and administrative facilitation ensured the smooth conduct of this event. I would also like to place on record our appreciation for the Research Day Organizing Committee and various subcommittees. They have worked very hard. They have planned meticulously before the event and during the event to ensure its seamless execution. I consider it my bounden duty to acknowledge the exceptional guidance and leadership of our Dean Research, Professor Rehan Ulhaq. I want you to clap for him, whose vision and strategic direction have been central to the growth of research at AIIMS Bhopal. I would also like to specially acknowledge Dr. Neha Arya, Dr. Jitendra Singh, administrative officers at Research Cell, who have translated this vision into action and have been the backbone of Research Cell as well as the Research Day celebrations. I also extend my sincere and wholehearted appreciation to the dedicated Research Cell staff who have toiled tirelessly behind the scenes to ensure the smooth planning, coordination, and execution of this event. Above all, we salute our dedicated faculty members, researchers, students, and staff. A big round of applause for all of them. Your curiosity, commitment, and tireless pursuit of excellence lie at the heart of the fourth Research Day. This occasion proudly celebrates your collective scholarly achievements and spirit of innovation. Thank you, one and all.
Thank you very much, ma'am. As we come to the close of today's program, may I request everyone present to kindly stand in honor of our national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे।
This brings us to the formal conclusion of this Research Day program. We extend our sincere gratitude to all our esteemed dignitaries, honored guests, and all members of AIIMS Bhopal family for their gracious presence and valuable participation.
आपकी उपस्थिति ने हमें आने वाले वर्ष के लिए उत्साह, गति और उपलब्धियां को आगे बढ़ाने के लिए अत्यंत प्रेरित किया है। सभी पुरस्कार विजेताओं, छात्रों और शोधकर्ताओं, संकाय सदस्यों को उनकी उत्कृष्ट उपलब्धियों के लिए बधाई।
May we now invite you all to please proceed for high tea, which has been arranged following this event. Thank you very much.